Okay.
Chananda.
Good evening, everybody. Today we are going to organize an international webinar on COVID-19, issues of its spread and impact on human society. Honorable President Dr. Paresnath Banerjee, Honorable Vice President Dr. Somnath Mukherjee, Honorable Speakers, Honorable Advisory Board members, our most valued invited guests, ladies and gentlemen. The said webinar is organized by Indian Medical Association, IMA, Katwa Branch, in collaboration with Bijnan Chetona, Katwa, Purba Bardhaman, West Bengal, India. At first, I request to Dr. Paresnath Banerjee, our honorary president of the said webinar, to deliver his valuable presidential speech. Sir, please be proceed.
Dear Professor A. Gomes, dear Mona Lisa Mallik, dear Dr. Subodh Kumar Datta, dear Dr. Chandan Sen, and organizer of the webinar. It is a great privilege on my part to accompany you all in this fine evening. I, on behalf of Katwa IMA branch, as president, extend heartiest thanks to all of you for attending this webinar, for sparing your valuable moment. It is a matter of great concern to us that COVID-19, alias coronavirus, is markedly increasing day by day in a limping manner throughout the world. I will be consoling all my country only. In our country, coronavirus affection is increasing day by day, causing thousands of mortality and morbidity. Anyway, we should not be afraid about the coronavirus. Government of India and state government machines are trying to fight against the virus constantly. I hope we will conquer over the coronavirus very soon. We should not be afraid of COVID virus at all. Today, many eminent doctors and educationalists will join over the discussion and they will express their valuable suggestions and opinions. Those will be very good asset for all of us. No more today. Once again, I express my sincere thanks to all of you. Good night. Thank you, Dr.
Thank you, Dr. Banerjee, for sharing your views with us. Thank you very much. Now we are going to our first resource person, Dr. Mona Lisa Mallik from USA. Good evening, madam.
Good evening.
Dr. Mona Lisa Mallik is acting as an assistant professor, Washington University of St. Louis. Now she will deliver a nice speech on COVID-19 in USA. Dr. Mallik, please start.
Thank you, and good evening, good morning here. Greetings from the United States. I'm so glad to see that the Indian Medical Association Katwa Branch is taking such a proactive part in raising public and community awareness during this time of global crisis. I am so honored to be invited as a speaker. As you know, I'm a physician in the United States in St. Louis, and that's a city in the middle of the country. I work as a hospitalist here, which I don't think there is a hospitalist role in India. But basically, a hospitalist is, just as the name suggests, a physician who works in the hospital setting and takes care of the inpatient population. So therefore, I've taken care of quite a few COVID patients who've been admitted to my service. And so my talk will emphasize on things that I have taken care of and seen. First slide, please. Can I have the first slide? Well, next slide. We can move on to the next slide, the objectives. Yeah, so the objectives of my talk are that is to kind of gain an understanding of the SARS-CoV-2, which is also called COVID-19 for short. So it stands for acute respiratory syndrome coronavirus 2. The signs and symptoms that are associated with it, the treatments that are available to us, the COVID-19 briefly in the United States, and how to stop the spread. Next slide, please. So understanding the virus sort of explains a lot of the symptomatology that we see with the COVID virus, and therefore I think it's important to have some understanding as to what goes on with how this virus sort of interacts with the human body. So as you may know, the severe acute respiratory syndrome virus, the COVID-19, was initially discovered in Wuhan, China, in a patient who had respiratory disease. And that was back in 2019, and hence the name COVID-19. It has 90% genetic similarity to bat coronavirus and 80% identical to SARS-CoV, which is also was not called SARS-CoV-1. It's just by default called SARS-CoV, and that's the coronavirus that was around back in 2002. So it is important to note how this virus enters into the human cell and thus cause infection. Next slide. Next slide. So the SARS-CoV-2, the COVID-19 virus, basically uses the ACE2 receptor, which is called the angiotensin converting 2 receptor in the human body to enter the cells. So these ACE2 receptors are well populated in the lungs, and they're also in many other tissues, but lungs being one of them. And thus, that's where they make an entry. That's one of the places, one of the predominant places where it makes an entry into the human body. Additionally, the virus entry is also dependent on another enzyme. It's a serine protease enzyme. It's called TMPRSS2. So these two, and TMPRSS2 is also in the alveoli of the lung. So to enter a host cell, the spike protein of the COVID-19 virus. So the COVID-19 virus has these proteins. One of them on the outer membrane is called the spike protein. So that has to be primed by the human host enzyme, the TMPRSS2, and also another enzyme, another endosomal enzyme. Okay, so that's how basically it makes an entry into the cell. So the mechanisms are important to understand, because to make an impact on how to overcome these cell entry, we would have to know how the cell enters into the host, how the virus enters into the host cell. So additionally, the SARS-CoV virus is also involved in inflammatory mechanism. So that's the beginning of the entry, but later on in the virus's life cycle, it induces inflammatory pathways, which leads to this cytokine storm. So initially, the inflammatory pathway is useful because that's the body's way of fighting the infection. But then when that goes out of control, that's when these inflammatory cells not only would attack the virus, but it also affects one's own tissue. And hence you get all these diseases like acute or adult respiratory distress syndrome and other kidney injury and other organ injury. It also to note is that ACE2 is an inactivator of angiotensin 2. And angiotensin 2, as many of our physicians, friends know, that it is a potent vasoconstrictor and also a pro-inflammatory cytokine. So with these ACE2 being used up, and the ACE2 is used up because the viruses are binding to the ACE2, and they're basically not on the cell surfaces anymore. So it leaves the angiotensin 2 without any checks and balances. And so then the renin-angiotensin aldosterone system kind of goes out of whack with this vasoconstrictor response. And then there's also these pro-inflammatory response that we encounter, which is why you get so many issues with blood clots and so on. Next slide. Next slide. Can you advance to the next slide? So basically, I think the next slide sort of talks about some of the symptoms that we see with SARS-CoV-2. I don't see the slide yet, but and basically these manifestations, I think we're all pretty aware of by now. They consist of upper respiratory infections like runny nose, sore throat, headache, confusion, predominantly a lot of respiratory symptoms that you can see: cough, shortness of breath. It can also cause diarrhea and fever, of course. I think our screen might be frozen. I'm waiting for the next slide. Okay, so in the interest of time, and another additional symptom that we can also see is lack of sense of smell and taste, which is not necessarily unique to SARS-CoV. We see that with other viruses as well, but it's one of the notable features of this virus. So the incubation period of this virus is about 4 to 14 days. And pneumonia, as we said, is one of the more frequent and serious manifestations of this disease. 15% of these people have hypoxia, and those are graded between mild, moderate, and severe based on symptoms. So mild is if you're able to carry on your everyday work, but you're a little short of breath. And severe would be shortness of breath even at rest with oxygen saturation of less than 94%. And at that point, people usually end up getting admitted to the hospital. It is also associated with excessive pulmonary involvement. And acute respiratory distress syndrome is a major complication, and that can start shortly after a person becomes short of breath. I think the average time is about 2 to 2.5 days. Other complications are thromboembolic events, as I had mentioned, blood clots, cardiac injury, which may not necessarily be a heart attack, but it can also be elevated troponin, a cardiac injury marker due to stress to the heart, and also other inflammatory complications. This COVID-19 can affect any age, but it is middle-aged and older adults are more susceptible to the illness. So on the next slide, I sort of talk about an additional cohort of people who are more susceptible to serious diseases. And as you can probably come to the conclusion that people who are immunocompromised, as in cancer, or other groups of people, those who have diabetes, etc., are at higher risk for getting a serious complication of COVID-19. Interestingly, also, smokers and people who have COPD have a greater manifestation or greater seriousness of the illness because those receptors that I talked about, the ACE2 and TMPRSS2, are more expressed in people who smoke. So hence that correlation there. Sorry, my PowerPoint kicked me out also. So I'm trying to find my place. Okay, so how to diagnose this COVID-19? So I'm on testing. It is before that. How to diagnose? So there is a PCR assay test for COVID-19, which is a nasopharyngeal swab that we do, goes in through the nose. There are other ways to do it also, like through the mouth, but nose is more thought to be more sensitive because in the mouth, the oropharyngeal is often contaminated with spit. Of course, if it's gotten directly from the respiratory bronchi, as in with a bronch, that is obviously is going to be more sensitive. These tests have pretty good true positives. The false negative rate are largely dependent on sampling. So if the person who's sampling it did not do a very good job, then it might show up as a false negative, or it could be too early in the disease. I think the best period to check is when a person's been infected for about a week. If a person just got exposed and you checked it the next day, that might be negative. So the timing is important, and it's hard to know exactly when a person came in contact, so you may get false negative for that reason. Serologic tests, which is when the person seroconverts, develops antibody, can take weeks, and it is uncertain as to how that correlates with the person's immunity. Next slide. Some additional tests that we get on people with COVID-19 who get admitted, these are on inpatients, are D-dimer. So this D-dimer, this is not a set way of doing things, but most hospitals in the United States use the D-dimer, and they may have different levels of cutoff as to when they consider that level significant. In my hospital, a D-dimer level more than 6 times normal, which is about 3,000, is taken into account with other things as to an indicator of them being very prothrombotic. And if a person's COVID-19 with a D-dimer of greater than 3,000, they're started on therapeutic dose of anticoagulation, which can be Lovenox or Eliquis or Pixaban, or rivaroxaban. So those medications are started along with consideration of their other issues. As we said, the COVID-19 is a virus that makes your body pro-inflammatory. Other things, CRP is sort of a surrogate marker for interleukin-6, which is another cytokine that is released with the cytokine storm. And these markers suggest poor prognostication. Okay, so elevated D-dimer, elevated CRP, elevated LDH. Troponin is a marker for myocardial injury. And ferritin is an acute phase reactant that goes up when your body's under inflammatory response. So that may go up also, as well as CPK. And interestingly, in COVID-19, the lymphocyte count decreases. So you actually have lymphopenia. So if a person comes in with lab results, now we're seeing so many COVID-19s, but of course these people can have other viruses too. So if you see someone with lymphocytosis, then you should think again about this being necessarily a COVID-19. It may not be. It could be some other virus or something else. So lymphopenia is another big thing to note for. Next slide. So the next slide is a CT slice of a patient who has COVID-19. So in the United States, the American Radiology Association does not necessarily ask you or necessitate a CT image of a person who's admitted with COVID-19. A chest X-ray is sufficient. But in China, a lot of these people had gotten CT scan. Here in the United States, in my hospital, if the clinical picture is unclear or we need a more detailed view, then we certainly follow up the chest X-ray with a CT scan. But a typical CT scan finding, and these CT scan also are rated as typical, indeterminate, or atypical of COVID-19. So those are the three categories that these CT scans get read as. So this is a typical COVID-19 scan where you see the ground glass opacity, which is the lucent sort of area around the periphery. So COVID-19 affects the periphery of the lung, has ground glass opacity, and then has septal thickening, which is these increased lung marking that you see in the aerated lungs because of the inflammation of the septa. Next slide. So again, when it comes to management of these people, most patients luckily don't need to be admitted. However, there's a huge majority that do end up being admitted, and our hospitals in the United States, I don't know if it's in the news in India, but are largely getting overfilled in places where there's a surge in COVID-19 cases. But fortunately, most people don't need admission, and most of them have mild disease. We talked about the pharmacologic prophylaxis for these DVTs and PEs that we see, and I have a slide kind of going over that also. You continue the patient on all their home medications, like their antihypertensives and statins and so on, unless there's any contraindication. And then the medications that are on horizon are remdesivir and dexamethasone, two of the medications that have proven to make an impact in COVID-19 in patients who are admitted. So these are not medications we give in patients who are treated as an outpatient. So these are strictly for inpatient people. And then there's also a few clinical trials that are ongoing. And if any of these trial medications are used, then it is highly recommended that they're not used as a sideline, but these people are actually enrolled in the clinical trial. So any adverse reaction or any benefits can be accounted for. Next slide. So the next slide basically sort of details the anticoagulation. And as I said, you base it on the D-dimer at our hospital. Anyway, the threshold is 6 times greater than the normal cutoff. And then you put them on therapeutic anticoagulation. And most of these people, unless there's contraindication, they leave with therapeutic anticoagulation dose for up to a month from their discharge. If they don't need therapeutic anticoagulation, then unless there's contraindication, all people get started on prophylactic dose of anticoagulation. I think it's 2 slides down now. So I'm on remdesivir for treatment of COVID-19. So this is next one. Next slide. Okay, so it's the next slide. But the remdesivir for the treatment of COVID-19 is this paper just very recently came out within the last month in the New England Journal of Medicine. And it's one of the very few drugs that have shown to increase It is one of the few drugs that have shown to decrease the median recovery time. So this is a double-blinded, randomized, placebo-controlled trial. So in this trial, which has a large number of patients, comparing remdesivir treatment for 10 days versus placebo for the equal amount of time, showed that median recovery time, which they said was discharge from hospitalization, was 11 days in the remdesivir group versus 15 days in the placebo group. And also there's a mortality benefit. In the remdesivir group, mortality went down to 7% versus 12% in the placebo group. So this is very interesting. Remdesivir is most helpful towards the beginning of infection. So it is most helpful when a person, not an outpatient, but when a person has shortness of breath and is admitted to the hospital, or has shortness of breath and has oxygen need, but not on ventilator. So this benefit becomes reduced when the person is on ventilator treatment. So if you're having to ration the drug, as in if you have limited supply, then it's most useful to give it to the patients who are on either room air, short of breath in the hospital, or nasal cannula oxygen before you give it to the people who are on the ventilator. Next slide. So this is a little bit of contrast to dexamethasone, which is the other drug this is another recent paper within the last month that came out in New England Journal of Medicine that has shown benefit. But the difference is that dexamethasone is most beneficial towards in people who are sicker. So the idea is the dexamethasone basically helps with the cytokine storm as an anti-inflammatory drug. So this study compares dexamethasone low dose, which is 6 milligrams a day, versus placebo for 10 days. And it's found that the incidence of death is lower among patients who are receiving invasive ventilation. So that's when the benefit was most pronounced. There was also some benefit of giving it to people who were just on oxygen, but there was actually no benefit. And in fact, there's harm in giving it to people who are not on oxygen. So this is for this, and in most of these cases, the dexamethasone was started after about a week of illness, after about a week into the illness, which makes most sense because that's when you would kind of expect the cytokine storm to happen. Next slide. Even more recently, I think within the last week or 2 weeks in New England Journal of Medicine, there is this other paper about a vaccine, mRNA vaccine against SARS-CoV-2 virus. And in this, this study has a series of 2 shots given 28 days apart to 45 people. And all 45 basically showed an antibody response with minimum side effects. So I think it has all the go-ahead for increased production and for increased trial. So this study is very promising. A series of 2 shots it's an mRNA vaccine that are given 28 days apart. So the next slide basically shows COVID-19 cases in the United States compared to other countries. There's a graph that shows United States, Brazil.
Madam, 2 minutes remaining. Just 2 minutes remaining, ma'am.
Okay, sure. Thank you. Yeah, I'll be done. So it shows in comparison to other countries, and it's interesting. So United States is in the black line, and you can see it's soaring. Next slide. This other slide that I have is basically is COVID admissions in our hospital in St. Louis. And as this graph shows when it comes up, is that there's a peak in April. That bump that you see, the initial bump is in April. That's when all the hospitals had shut down, and then reopening happened with other services opening up, elective surgeries opening up, and then now we're seeing a rise in the COVID-19 cases again. Next slide. Talks about transmission. Is basically person-to-person transmission is basically via respiratory droplet. And it's more likely that these people are transmitting earlier on in their infection as opposed to later on. because earlier on is when the viral replication is happening. And therefore, it's super important. And sometimes these people are even transmitting infection, although they're not symptomatic. Hence, everyone needs to be masked and so on, because the asymptomatic person can be transmitting this virus. So washing hands, wearing masks, and social distancing is super important. Next slide. So our current CDC guideline on the next slide, as it'll show, is that for healthcare professionals to not only wear a mask, but also a face shield for people who are, when they're dealing with patients. And this is basically what you look like when you're wearing a mask and a gown and a face shield and a cap. Next slide. So in conclusion, basically COVID-19 has changed the landscape of our planet. And the best way so far to stay ahead of the game is to stop the spread of the disease, because we don't have a great solution, although a vaccine is in the pipeline. I think COVID-19 has gotten in the ways of interpersonal relationship and how we handle our economy and how politics is going, and even how we're conducting this international conference through this online. So lastly, I wanted to thank all of my viewers, and also I wanted to extend a special thanks to the organizing committee for all the hard work that they have done behind the scenes and the multiple rehearsals we have had. Thank you all so much for having me as a speaker.
Thank you, Dr. Mollik, for your valuable speech on COVID-19 in USA. Now it is open for the interactive session, just for 2 minutes. No questions here, ma'am.
I must have answered all the questions.
Yeah, more than 600 participants here and more than 200 students here, ma'am.
Excellent.
স্টুডেন্টের তরফ থেকে কোশ্চেন করো, কেউ ম্যাডামকে কোশ্চেন করো।
আপনাদের কি সব উত্তর প্রশ্নের উত্তর অ্যানসার হয়ে গিয়েছে মনে হচ্ছে?
এখানে অনেক স্টুডেন্টস রয়েছে, মোর দ্যান 200 স্টুডেন্টস পার্টিসিপেন্ট হিসেবে জয়েন করেছে, বাট এখন অবধি একটা কোশ্চেন এখন আসেনি তাদের তরফ থেকে।
আচ্ছা, I hope it made sense.
Ma'am, one question here: what is the most contagious period of an asymptomatic COVID patient?
Yeah,
from Dr. Purnali Raibasu.
That's an excellent question. So the thought is the most contagious period is during the beginning of the illness. So up to, like, we say quarantine for 14 days. So up to 10 days or so is the most contagious period after someone's exposed. After that, you can still have viral shedding, but it is unclear whether that viral shedding contributes much to the virus spread. But yeah, good question. The viral replication happens towards the beginning, so during the beginning.
Thank you, ma'am. Ma'am, our next question is how an asymptomatic carrier of COVID-19 can be identified as they don't have any symptoms?
Yeah, that's the challenge, is you cannot identify who is carrying the virus. So therefore, universal masking, because you yourself may be a youngster and not sick, but you could pass it on to your older grandparents or older relatives or friends. So, and some people who have minimum symptoms or no symptoms, one of the symptoms that's seen in young people is they have a sense of loss of smell and taste. So if all of a sudden you have this weird loss of sense of taste or smell out of nowhere that's unexplained, then highly suspect COVID-19 infection.
Ma'am, next question: when one should go for COVID-19 test?
Yeah, so if the test is available, if the test is readily available, then if you have symptoms, you can get tested for epidemiologic reasons, just to see how much of the population is affected. But if the test is sort of sparse and not as readily available, then only get tested if you have other comorbid conditions, like if you have heart diseases or diabetes or cancer, if you are a family member of somebody with those diseases, or if you are a first line responder, which is if you're a healthcare worker, and if you are, then you would be exposing other people. Or if you are, or if you're a public servant, like needing to be around large crowds, then you should get tested. Otherwise, if you're sick and not needing to be hospitalized, and the tests are in short supply, then it's equally fine to quarantine yourself for 14 days and 3 days, 72 hours of completely being free of symptoms.
Okay, ma'am. Thank you. Thank you very much. Now we are going to our second resource person, Dr. Subodh Kumar Datto. Good evening, sir.
Good evening.
Dr. Subodh Kumar Datto did his MBBS degree from NRS Medical College, Kolkata in 1980. After that, he has obtained his DGO from Chittaranjan Seva Sadan, Kolkata in 1982. He did his MD in gynecology from AIIMS, New Delhi in 1997. After that, he went to USA to achieve his MD in gynecology, and he obtained his MD in gynecology from Lincoln Hospital, affiliated to Cornell University in the year of 2007. After that, he completed his FSCOG in the year of 2012. Now, I request to Dr. Datto to deliver your talk on impact of COVID-19 in gynecological practice. Dr. Datto, please.
Good evening, everybody. My topic is how COVID-19 has changed the practice of obstetrics and gynecology. And my previous speaker has almost explained everything about the epidemiology, treatment, and the prognosis. So I'm not going into detail of that part. I will concentrate my speech only in the gynecological field. Gynecological field-এ দুটো পার্ট আছে, একটা হচ্ছে obstetrics পার্ট আর একটা হচ্ছে gynecological পার্ট। gynecological পার্ট তা আমরা ডিল করি যেখানে কোনো menstrual প্রবলেম, কোনো যখন মেনস্ট্রুয়েশন বেশি হয়, যখন আমাদের কোনো মেডিসিন দিয়ে আমরা মেনস্ট্রুয়েশন কন্ট্রোল করতে পারি না, তখন আমাদের অপারেটিভ ফিল্ডে যেতে হয়। এটা হচ্ছে গাইনোকোলজিক্যাল পার্ট। অবস্টেট্রিক্স পার্টটা হচ্ছে যে মোর রিলেটেড টু চাইল্ড বার্থ। সো আমার স্পিচটা হবে মেনলি অবস্টেট্রিক্স, গাইনোকোলজি, infertility practice, or baby mother bondage after delivery, and the diagnosis part. আমি প্রথমেই চলে যাচ্ছি আমাদের ডায়াগনোসিস পার্ট। তার মানে আমরা যে কোনো জিনিস, যে কোনো গাইনোকোলজিক্যাল বা অবস্টেট্রিক্স প্রবলেম যখন আমরা ফেস করি, তখন আমাদের একটাই ইনভেস্টিগেশন থাকে, সেটা হচ্ছে আল্ট্রাসাউন্ড। ফার্স্ট ইনভেস্টিগেশন ফার্স্ট চয়েস হচ্ছে আল্ট্রাসাউন্ড, সেকেন্ড চয়েস হচ্ছে আল্ট্রাসাউন্ড, থার্ড চয়েস হচ্ছে আল্ট্রাসাউন্ড। কাজেই আমরা আল্ট্রাসাউন্ডটা কিভাবে করব সেটা আমাদের ভীষণ ইম্পর্টেন্ট। তার কারণ এতদিন ধরে আমরা দেখে এসেছি যে আল্ট্রাসাউন্ড হয় একটা চারিধারে বদ্ধ ঘরে, এসি চলছে, অনেক লোকজন আছে, এইভাবে আমরা অভ্যস্ত। কিন্তু কোভিড-19 এসে আমাদের এই ধ্যান ধারণাকে একদম বদলে দিয়েছে। এখন আমাদের মোটামুটি ভাবে 5টা জিনিসের ওপর নজর রাখতে হবে যাতে এই কোভিড-19টা আমরা স্প্রেড বন্ধ করতে পারি। ঘরে আর এসি থাকবে না। যত এসি থাকবে, ঘরে যত আমরা এসি ইউজ করব, তত সেম এয়ার সার্কুলেশন হবে, এবং যদি তার মধ্যে কোনো কোভিড-19 পেশেন্ট থাকে, সে ভাইরাসগুলোকে প্রত্যেকের মধ্যে ট্রান্সমিট করে দেবে। কাজেই আমরা এসি ঘরে আর আল্ট্রাসাউন্ড করতে পারছি না। because of this COVID-19. That is number one. Number two, minimum people. একজন আল্ট্রাসাউন্ড করতে আসছে, তার সঙ্গে তার দাদু, তার হাজব্যান্ড, তার বাচ্চা মেয়ে সবাই ঢুকে যাচ্ছে আল্ট্রাসাউন্ড রুমে। This cannot be. Only patient will come, nobody else. Same is true from the medical and paramedical side. ডাক্তার থাকবে আর একজন রেকর্ডার থাকবে যে সমস্ত ডাটাগুলো পুট করবে। So there will be only 3%, one patient, one doctor and one recorder, and that's it. এই নয় যে ডাক্তারের সঙ্গে 5 জন অ্যাসিস্ট্যান্ট এবং 3 জন নার্সিং স্টাফ, একটা 10 জনের মিলে ঘরে আমরা। So both from the patient side and from the doctor side আমরা মিনিমাম হেডস অফ পার্সন সেখানে অ্যালাউ করব। নাম্বার 4 হচ্ছে আল্ট্রাসাউন্ড করার আগে প্রত্যেক দিন তার প্রোব, তার কম্পিউটার কি, তার হ্যান্ডরেল, তার চেয়ার, টেবিল, ডোরনব, হ্যান্ডরেল, everything should be cleaned with 70% isopropyl alcohol. তার কারণ প্রত্যেকটা লোক ঘরে ঢুকছে, সে ডোরনবে হাত দিচ্ছে এবং সে কন্ট্যাক্ট ট্রান্সমিশন, যেটা আমার প্রিভিয়াস স্পিকার বলে গেল, কন্ট্যাক্ট ট্রান্সমিশন আমরা অ্যাভয়েড করতে হবে। সো প্রত্যেকটা জিনিস আমাদের ভালোভাবে 70% আইসোপ্রোপাইল অ্যালকোহল দিয়ে ধুয়ে তারপরে ওয়াশ করে তারপরে আমাদের রেডি করতে হবে। শুধু তাই নয়, প্রত্যেকটা পেশেন্ট আসবে এবং তার সেই শিট চেঞ্জ করে দিতে হবে, যাতে আমরা আগের পেশেন্টের যদি COVID-19 থাকে সেটা আমরা ট্রান্সমিট করতে দিতে পারবো না। 5 নম্বর পয়েন্ট হচ্ছে আমাদের নাম্বার অফ আল্ট্রাসাউন্ড করতে হবে। যখনই আল্ট্রাসাউন্ড করি, কিন্তু এই কোভিডটাতে আমাদের মোটামুটি ভাবে পেশেন্টকে আমরা 12 সপ্তাহে আল্ট্রাসাউন্ড করব, উইদিন 12 সপ্তাহে অফ প্রেগন্যান্সি। আর একটা হচ্ছে অ্যানোমালি স্ক্যান 18 to 20 উইকস এ একটা, তারপরে আমরা ম্যাক্সিমাম একটা আমরা মোটামুটি করি 37 উইকস এ, আর তার আগে একটা করতে পারি। মোটামুটি 3 থেকে 4টে একটা প্রেগন্যান্সি পিরিয়ডে আমরা আল্ট্রাসাউন্ডটা তার মধ্যে সীমাবদ্ধ থাকবে। তার বেশি হতে পারে, সেটা অন্য কমপ্লিকেটেড কেসে। আল্ট্রাসাউন্ড আমরা করি শুধুমাত্র অ্যাবডোমিনাল নয়, আমরা ভ্যাজাইনাল রুট দিয়ে আল্ট্রাসাউন্ড করি। আমাদের ভ্যাজাইনাল রুট দিয়ে আল্ট্রাসাউন্ড, নাম্বার অফ ভ্যাজাইনাল আল্ট্রাসাউন্ড আমাদের কমিয়ে ফেলতে হবে। যদিও জানি কিছু কিছু ক্ষেত্রে ভ্যাজাইনাল আল্ট্রাসাউন্ডের কোনো বিকল্প নেই, কিন্তু এই COVID-19 এরাতে আমাদের ভ্যাজাইনাল আল্ট্রাসাউন্ড, কিছু কিছু প্রসিডিওর আমরা করি আল্ট্রাসাউন্ডের মাধ্যমে, সেই সব আল্ট্রাসাউন্ড গুলো আমাদের মিনিমাম অ্যামাউন্টে নিয়ে যেতে হবে। এই গেল আল্ট্রাসাউন্ডের দিক থেকে, পয়েন্ট অফ ভিউ থেকে ডিসকাশন। এইবার আমরা আসছি কিভাবে আমরা একটা প্রেগন্যান্ট লেডিকে দেখব এবং তার পরিচর্যা করব। প্রেগন্যান্ট লেডি যখন আসবে তখন প্রত্যেকটা, যদি তার ডেলিভারি সময় সে আসে, তাকে আমরা মোটামুটি একটা ওয়েল ইকুইপড জায়গায় আমরা একটা কোভিড টেস্ট করে নিই। কিন্তু আমাদের খুব সীমিত ক্ষমতা, এটা ইউএসএ নয়, এটা ইন্ডিয়া। আমাদের ইচ্ছা করলেই আমরা COVID-19 টেস্ট করতে পারবো না। আমি অনেক ডেলিভারি করছি COVID-19 টেস্ট না করে, তা আমি করতে বাধ্য। তাছাড়া কোনো সব সময় আমাদের সেটা সম্ভব হচ্ছে না। এই মুহূর্তে কাটোয়ায় COVID-19 অনেক বেশি স্প্রেড করে গেছে আগের থেকে। আমাদের সে ব্যাপারে চিন্তা করতে হবে যে আমরা প্রত্যেকটা ডেলিভারি করব COVID-19 টেস্ট করে, সেটাই হওয়া উচিত। যদি সেই প্রভিশন না থাকে, তাহলে আমরা সাসপেক্ট, একটা করতে পারি কোভিড সাসপেক্ট এবং কোভিড টেস্ট করতে পারি, তাহলে আমরা তিনটে ভাগে ভাগ করতে পারি। ওয়ান ইজ কোভিড পজিটিভ, ওয়ান ইজ কোভিড নেগেটিভ, ওয়ান ইজ কোভিড সাসপেক্ট। কোভিড সাসপেক্ট কিছুদিন ধরে আমরা কোয়ারেন্টাইনে রাখতে পারি, তার এ হবে, তার টেস্ট হবে, যদি হয় তাহলে কোভিড পজিটিভ গ্রুপে দেবো, যদি কোভিড নেগেটিভ হয় তাহলে নর্মাল পেশেন্টের মতো তাকে ডেলিভারি করব। ডেলিভারি কি করে করব? সিজারিয়ান সেকশন করে না নর্মাল ডেলিভারি? As per the WHO guideline, cesarean section will be done only in obstetric indication. এই নয় যে COVID-19 হলেই সঙ্গে সঙ্গে আমি সিজার করে দেবো, কিন্তু এখানে অনেক কিছু বলার আছে। একটা নর্মাল ডেলিভারি করতে গেলে আমাকে একটা পেশেন্টকে মোটামুটি ভাবে 15 থেকে 20 ঘন্টা তার কন্ট্যাক্টে থাকতে হবে। আমাকে প্রত্যেক 3 ঘন্টা অন্তর অন্তর তাকে গিয়ে তাকে এক্সামিন করতে হবে। আমি যদি জানি সেই পেশেন্ট কোভিড পজিটিভ, will it be possible for me to go to that patient and to spend hours and hours with that patient? Probably not. So এইখানে যদিও আমরা বলছি যে কোভিড-19 হলে শুধুমাত্র অবস্টেটিক ইন্ডিকেশনেই আমরা সিজারিয়ান সেকশন করব, এখানে কিন্তু অন্য কথা স্কোপ আছে বলে আমার মনে হচ্ছে। কিছু কিছু ক্ষেত্রে কোভিড পজিটিভ, আমি সিজারিয়ান সেকশন করে দিলাম, আমার সঙ্গে পেশেন্টের যদিও ডাইরেক্ট কন্ট্যাক্ট অনেক কমে গেল, আধ ঘন্টার মধ্যে 45 মিনিটসের মধ্যে, তারপরে আমি মোটামুটি তার থেকে ডিস্টেন্স মেনটেন করে আমি সেই ডেলিভারি উতরে দিতে পারি, কিন্তু সেটা কতটা ফিজিবল বিভিন্ন জায়গায় এখানে অনেক কথা বলার আছে। ডেলিভারি হয়ে গেল, এইবার মায়ের সঙ্গে বেবির বন্ডেজ, সেই বন্ডেজটা ভেরি ইম্পর্ট্যান্ট। আমাদের নিয়ম হচ্ছে যে বেবি ডেলিভারি হলেই সঙ্গে সঙ্গে মাকে বুকের মধ্যে দিয়ে দাও, তার ব্রেস্ট মিল্ক সাক করুক, কিন্তু এইখানে আমাদের যারা কোভিড পজিটিভ পেশেন্ট তাদের মিল্ক দেওয়ার আগে তাকে প্রপারলি স্যানিটাইজ, তার সমস্ত জিনিস স্যানিটাইজ করতে হবে, তাকে হাত ধুতে বলতে হবে, তার ব্রেস্ট এবং আপার চেস্ট ভালোভাবে স্যানিটাইজ করে তারপরে বেবিকে মায়ের কাছে দিতে হবে। আমরা এমন করতে পারি, একটা হেল্পিং হ্যান্ড দরকার হতে পারে, সে ইনিশিয়াল পার্টে চেষ্টা করবে যে মাকে এবং বেবির যাতে এই জিনিসটা ভালোভাবে মেনটেন হয়। আমরা একই ঘরে রাখতে পারি, আলাদা ঘরে রাখতে পারি, একই ঘরে রাখলে আমাকে সেপারেটর দিয়ে সেপারেট করতে হবে এবং টাইম টু টাইম ব্রেস্ট ফিড করতে হবে। যদিও আমরা জানি যে প্ল্যাসেন্টাল ট্রান্সফার অফ কোভিড-19 হয় না, কাজেই যদি কোনো মায়ের বেবি যদি কোনো কোভিড-19 পজিটিভ পেশেন্টের যদি বেবি যদি পজিটিভ হয়ে যায়, তাহলে আমাদের এটা ধরে নিতে হবে যেটা এটা আফটার ডেলিভারি হয়েছে, নট ফ্রম দ্য প্ল্যাসেন্টাল ট্রান্সফার অফ কোভিড-19 ভাইরাস। So that is a piece of information. এইবার আমরা যাচ্ছি গাইনোকোলজিক্যাল প্র্যাকটিসে। আমরা একটা পেশেন্টের মেনোরেজিয়া হচ্ছে, মানে প্রচন্ড মাসিক হচ্ছে, ব্লিডিং হচ্ছে, তাকে আমি মেডিসিন দিয়ে তার ট্রিট করতে পারলাম না, এখন তাকে অপারেশন করতে হবে। আমরা যতদূর সম্ভব চেষ্টা করব যে তাকে যাতে তার মেডিকেল ট্রিটমেন্ট করে তার ট্রিটমেন্ট আমরা তাকে ক্রাইসিস পিরিয়ডটা ওভারকাম করতে পারি, কিন্তু কিছু কিছু ক্ষেত্রে হলে অপারেশন হবে। কাজেই সেই জিনিসটা, সেই স্ক্রিনিংটা ভেরি ইম্পর্টেন্ট। কাকে অপারেশন করবো, অপারেশন করবো না, সেটা ডক্টরের উপর নির্ভর করছে। এবং ইমিডিয়েটলি হাফ অ্যান আওয়ার তাকে ওটি টেবিলে নিতে হবে, তখন সেটা আমাকে অ্যানাস্থেসিস্টের সঙ্গে কথা বলতে হবে। যে কোনো অপারেশন করতে গেলে আমাদের অ্যানাস্থেসিস্টের হেল্প নিতে হয়। কিভাবে অপারেশন হবে সেটা অ্যানাস্থেসিস্টই ঠিক করবেন, সেটা জেনারেল না রিজিওনাল। রিজিওনাল অ্যানাস্থেসিয়া সব সময় প্রেফার্ড ইন কোভিড-19 এরা, তার কারণ জেনারেল অ্যানাস্থেসিয়াতে অনেক প্রবলেম আছে, সেই প্রবলেমগুলো কি আস্তে আস্তে আমি বলছি। রিজিওনাল অ্যানাস্থেসিয়া, আমি যেখানে অপারেশন করব শুধু সেই পার্টটাকে যাতে অবশ করে তার অপারেশন করা যায় সেটা দেখা হয়, তাতে আমার এয়ারোসল ট্রান্সমিশন অনেক কম হয়। বাট জেনারেল অ্যানাস্থেসিয়া দিতে গেলে আমাকে এন্ডোট্রাকিয়াল টিউব পরাতে হবে। এন্ডোট্রাকিয়াল টিউব পরানো মানেই হচ্ছে পেশেন্টের একটা কাফিং রিফ্লেক্সটাকে ইনস্টিগেট করা। পেশেন্ট কাফলেই সে যদি পজিটিভ হয় তাহলে সে চারিধারে এয়ারোসল ছেটাবে এবং তাতে হোল এনভায়রনমেন্ট অফ দ্য ওটি উইল বি অ্যাফেক্টেড, and that do not want anybody does not want that. So আমরা যতদূর সম্ভব চেষ্টা করব।
Sir, please
Yes?
complete within 2 minutes, sir, please.
Okay, so আমরা চেষ্টা করব যাতে সেই ধরনের ওটি, যাতে হেপা ফিল্টার আছে, হেপা ফিল্টার হলে যদি থাকে তাহলে আমরা হেপা ফিল্টার ইউজ করে এই কোভিড ট্রান্সমিশনটাকে আমরা অনেকটা চেক করতে পারি। আরো একটা জিনিস হচ্ছে যে আমরা ল্যাপারোস্কোপি করব না না ওপেন সার্জারি করব। ল্যাপারোস্কোপি করার সময় অনেক আমার গ্যাস দিতে হয়। গ্যাস যখন বেরোয় তখন পেশেন্টের শরীর থেকে গ্যাস যখন বেরোয় তখন সেটা একটা এরোজল ফর্মেশন হয়ে বেরোয়, সেটা আমরা চাই না। সো ল্যাপারোস্কোপি ইজ নট ওয়ান্টেড অ্যাট দিস মোমেন্ট দেন ওপেন সার্জারি। ওপেন সার্জারি ইজ বেটার দেন ল্যাপারোস্কোপি। ইনফার্টিলিটি এতে চলে যাই আমরা। এখন বেশিরভাগ পেশেন্টে মেয়েদের বিয়ে হচ্ছে 28 বছর 30 বছর, তখন তাদের যখন তারা মনে করে যে তারা প্রেগন্যান্সি চিন্তা করে তখন তাদের বয়স 30-32 হয়ে যায়, এবং সেই সময় আমরা জানি যে নাম্বার অফ ওভাম গ্র্যাজুয়ালি ডিক্রিজ করে যায় সেই সময়। কাজেই এটা হচ্ছে একটা নর্মাল জিনিস। আমাদের রুজি রোজগার মানে সোশিও ইকোনমিক স্টেবিলিটি এবং ফ্যামিলি, স্টার্টিং ফ্যামিলি, এই দুটো একটা কনফ্লিক্টের মধ্যে অনেক মেয়ে চলে যাচ্ছে, যার জন্য ইনফার্টিলিটি প্র্যাকটিসটা অনেক 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 মেয়ে ইনফার্টিলিটি চিকিৎসা করতে হচ্ছে। সেটা কিভাবে অ্যাভয়েড করা যায় সেটা আমাদের আগের থেকে চিন্তা করতে হবে। এবং যদি দেখা যায় যে কোনো প্রসিডিওরাল, যেমন কারুর ক্যান্সার হয়েছে, তখন যদি আমি দেখি যে তার ওহাম পিক আপ করে যদি আমি সেটা প্রিজার্ভ করতে পারি, সেই সব জিনিসগুলো, সেই সব অপারেশন আমাকে, সিলেক্টিভ অপারেশন আমাকে করতে হবে। জেনারেলাইজড অপারেশন, জেনারেলাইজড ওভাম পিক আপ এবং আইভিএফ, ইক্সি, এইসব প্রসিডিওর আমরা অনেক কমিয়ে দেবো এই কোভিড-19 এরাতে। টেলিমেডিসিনের একটা আসছে। টেলিমেডিসিন ছাড়া এই কোভিড-19 আমরা ট্যাকল করতে পারবো না। কাজেই রোল অফ টেলিমেডিসিন ইজ ভেরি ইম্পর্টেন্ট ইন দিস কোভিড-19 এরা। আমরা চেষ্টা করব যাতে টেলিমেডিসিনের হেল্প নিয়ে আমরা অনেক বেশি ইফেক্টিভ ওয়েতে পেশেন্টের কাছে ফিজিক্যালি না পৌঁছলেও আমরা আমাদের অ্যাডভাইস দিতে পারি, সেটা আমাদের দেখতে হবে। That's it for now. আমি সিনসিয়ার থ্যাঙ্কস জানাচ্ছি অর্গানাইজারকে এবং কাটওয়া এই আমাকে এই স্কোপটা দেওয়ার জন্য। থ্যাংক ইউ ভেরি মাচ।
Thank you, Dr. Dotto, for your nice speech. Now it is open for our interactive session. Sir, you pick up only 2 questions, sir.
Yes.
Sir, can you hear me? Yeah. Okay. No questions here till now. Dear participants, no questions on the screen here, so please.
So I have made the thing very clear to everybody, right?
Yeah. Okay. Thank you, sir. Okay. Now we are going to our next resource person, Professor Dr. Anthony Gomes. Good evening, sir.
Good evening.
কোভিডের এই প্রেক্ষাপটে বেশ কিছু নতুন শব্দের সঙ্গে আমরা পরিচিত হয়েছি। তার মধ্যে একটি হলো হার্ড ইমিউনিটি। খবরের কাগজে পাতা উল্টালে এখন দেখা যাচ্ছে যে আগস্ট মাসেই নাকি তৈরি হবে সেই হার্ড ইমিউনিটি। কি বলছে বিশেষজ্ঞরা? না, যত বেশি সংক্রমণ বাড়বে তত বেশি নাকি আমাদের শরীরে হার্ড ইমিউনিটি তৈরি হবে। কিন্তু এই হার্ড ইমিউনিটি কিভাবে গড়ে তোলা সম্ভব, তার জন্য আমি যার সাথে আপনাদের পরিচয় করাবো তিনি হলেন প্রফেসর ডক্টর অ্যান্টনি গোমস। প্রফেসর অ্যান্টনি গোমস is an ex-professor and UGC Emeritus, UGC BSR Fellow of the Department of Physiology, University of Calcutta. He had his pre- and post-doctoral research training on venom and toxins at Calcutta School of Tropical Medicine. He has published 145 scientific articles in peer-reviewed national and international journals. Professor Gomes has 2 national and 1 US patent, written 4 book chapters, and guided 32 PhD students. Now I request you, sir, to Professor Gomes to deliver your valuable speech on boost your immunity with functional foods and fight against COVID-19. Sir, please.
Chandan, you can see?
Yeah, sir. Yeah. Okay. This is fine, sir.
Thank you, Dr. Roy, for your kind introduction. Good evening and welcome to this international webinar organized by Indian Medical Association, Katwa Branch, and Bijnan Chetona, Bardhaman. I would like to thank the President, IMA, and Secretary Bijnan Chetona for giving me this opportunity to share this floor. The topic of my lecture is Boost Your Immunity with Functional Food. These are the outlines of my talk. I'll talk a bit of COVID-19 basic body immunity and functional food, and finally 10 tips to boost your immunity. WHO declared COVID-19 a viral disease, a pandemic originated from Wuhan city of China, affecting 213 more than countries, 14.2 million, killing 600K people as on 25. The data is continuously changing. Every day we are also making records. Till today, there is no antidote, no vaccine, only symptomatic treatment. My first question, without antidote or vaccine, how they have recovered? The natural body immunity and symptomatic treatment. My second question, how to increase your body immunity? The present lecture will enlighten this issue using functional food. Today, the world is worried about COVID-19. Maybe next year, another deadly virus, followed by another. There is no end of bioweapon attack in this age of bioterrorism. Therefore, prepare yourself for a long battle against viral attack and disease. Let us try to understand what is COVID-19 and what is immunity and how you can improve your immunity. The objective of this lecture is to aware our next generation students, teachers, how to survive against viral disease through increasing our body immunity with functional food. Immunological threats are initiated by antigen, that is any foreign body, and viruses are submicroscopic infective agent found in every ecosystem capable of infecting living organism, including humans. When a virus infects a host cell, the host cell gets enslaved to the virus and synthesize thousands of identical copies of the original virus. Thereafter, the host cell dies in the process of releasing newly synthesized viral particles, continues till it is challenged with suitable antiviral agent. And this is the culprit. I call it a immunity breaker. Diameter 600 to 800 nanometer, appears round or oval, stable in plastics and stainless steels, inactivated by UV and heating. And these are the structural spike protein, envelope, and the membrane. Recently, there are several names, but this name I liked it. The US president called this virus as Kung Flu virus. So this is the Kung Flu virus, is the immunity breaker. This is how the virus affects the whole body, the clinical features, starting from systematic fever, fatigueness, there is kidney failure, there is intestinal diarrhea, and this is the respiratory system mostly affected: sneezing, runny nose, sore throat, dry cough, shortness of breath, and the circulatory system. This is how the system is damaged due to the virus, mostly from the damage of the immune system through spleen. There is spleen, there are liver injury, there are cardiovascular injury, GI injury, kidney injury, and many other, as the previous speaker also described you some of these, and acute respiratory distress syndrome. There are coagulation damages, and ultimately the immune system breaks, and there is cytokine storm. That means huge amount of cytokines that are liberated, and that produces the all-round sepsis and organ failure. This is already told by the earlier speaker. WHO recommends collecting sample from upper and lower respiratory tract, assessing the samples through RT-PCR. Isolation is the most effective measure, and the treatment includes symptomatic care and oxygen. And critically ill patients, they require high flow oxygen, dexamethasone. Already the first speaker told about this. What is immunity? Basics for the school children's. Immunity is a defense mechanism of our body against any foreign threat. It may be bacteria, virus, toxin, and foreign proteins. And what is immune system? The system which provides our immunity. And what is immunology? Study of immune system and the immunity. So this is how the organs of the immune system, comprising of the thymus, tonsil, lymph node, and there is spleen, appendix, bone marrow. These are the major structures linked with the immune system. There are two types of immunity. What is cellular? That certain cells of our body like macrophage, lymphocyte, neutrophil, fibroblast, mast cell, null cells, they provide our first line of defense. And humoral immunity is that there are certain chemicals like immunoglobulins, cytokines, interferon. They are formed inside our body, and they also provide immunity. This is humoral, and this is the cellular immunity. I'll go to the functional food now. The functional foods are foods that have potential positive effect on health beyond basic nutrition. And they help to reduce the risk of disease, and they act as immunomodulators. I'll utter this word immunomodulators many times in my lecture. They are probiotics. It can be probiotics divided into probiotics, prebiotics, and symbiotics. Probiotics, they are the living bacteria found in certain foods like dog doi. We get it from lactobacillus. And the prebiotics are mostly come from the undigested carbohydrate, mostly the fiber that the human intestine cannot digest. And the symbiotics is the mixture of pre and pro. They all signal to immune system and help regulate inflammation reduce risk of cancer, osteoporosis, cardiovascular disease, diabetes, and they form a barrier against bacteria and virus. This is food guide pyramid. You can use this for your designing menu. The lowest circuit is the list of cereals, bhat, roti, everything here. These are the vegetables and these are the fruits. This is the milk and milk products, and these are the meat, mach mangsho dim, and this is the least one, the sweet, the sugar and the salt. Functional food, like the vegetables and fruits, they provide nutrients like beta carotene, vitamin C, vitamin E, and they can boost immune function. The antioxidant like vitamin A, E, C, flavonoid, xanthophyll present in vegetables and fruit, they help reduce oxidative stress and increase calcium absorption. The active ingredients like beta carotene, vitamin C, D, E, and zinc, they all have antioxidant, anti-inflammatory, and immunomodulatory activity. The micronutrients like selenium, iron, copper, zinc, manganese, calcium, folate, they acts as an enzyme cofactor. They stimulate immune system. Selenium is an important for immune response, viral disease, and calcium and cancer prevention. Selenium deficiency leads to loss of immunocompetence. They reduce T and B cell of the immune system function, and is normally found in significant amount in immune tissues like liver, spleen, and lymph node. The common food sources of selenium are food grain, dairy products. I'll request the students to take care of these, like milk, yogurt, and cheese, chicken, sea fish, shellfish, egg, nuts. They contain high amount of selenium. The minimum daily requirement is 55 microgram. Take note of this, 55 microgram per adult per day. Zinc is another trace element that is critical to the development of immune cells and an important cofactor for many enzymes. The rich sources are lentil, rajma, soybean, Bengal gram, coconut, say 5 milligram percent, and groundnut, 12 milligram percent. The recommended daily allowance of zinc is 8 to 11 milligram per day, according to NIH. The dietary fiber, they are the elements from vegetables and fruits. They are mostly cellulose, hemicellulose, pectin, lignin, and they have the following function like the reduced blood sugar, cholesterol, regulation of bacterial balance, improve intestinal transit, reduce lipid peroxidation, increase fecal bulk. You can see this person having constipation, and isabgol is the thing that normally we take. The daily requirement, how much fiber we should take. According to American Diabetic and American Cancer Association, it should be around 40 grams per day per person. Rich fiber sources, take care, take note of these. Cereals, 8 to 15%, lady's finger, excellent vegetable, 8.2 gram per cup, guava, coconut, cornflakes, popcorn, very rich source. The plant origin, functional food and immunity, we may use many spices in our daily life, haldi, jeera, dhania, chili, ginger, garlic, garam masala, posto. These are all immunomodulators. FDA has recently approved oat soluble fiber and soluble fiber from Physalia seed husk, soybean, and plant sterol. Some of these are not yet approved by the FDA, like cranberries, garlic, nuts, and grapes. Health benefit of tea. Tea is having catechin compound and lycopene from tomato. They are all very good source of antioxidant and immunomodulators. Amla. See, amla, amloki, high content of vitamin C, 500 million, highest among everything. Curry leaf, high calcium, capsicum, high antioxidant power, guava, high soluble fiber like pectin and vitamin C. Asparagus, shataburi, very important source of fiber, folate, vitamin A, D, E, K, chromium, iron, copper, calcium, protein. They are all antioxidant and immunomodulator. And my favorite, mushroom, low calorie, high fiber, antioxidant, immunomodulator, high iron, selenium, vitamin D, B2 and B3. So you should take mushroom regularly. Animal origin products, they have always played an important role in human nutrition. since Stone Age. And like meat, fish, egg, they're excellent source of protein, essential amino acid, fatty acid, mineral, vitamin, and antioxidant, and bioactive peptides. They have a good source of vitamin D, B12, folate, and phosphorus and selenium. Milk is also a very good complex mixture of bioactive protein, lipid, saccharides, and contains numerous biological active substances like IgG, coenzyme, antimicrobial peptide, hormones, cytokine, growth factor, thiamine, riboflavin, B12, and minerals, calcium, magnesium, phosphorus, selenium, and zinc. Milk considered very potent antioxidant, antimicrobial, and immuno. Doodh pina hai, have every day, have milk. So these are some of the milk products you can see in the TV. Haldi milk, and Notun Guder milk, ice cream, fish and fish oil and immunity. Fish and fish oil and marine products like alga, seaweed, mussel, crab, they have associated with various health benefits, including cardiovascular disease, cancer, and viral infection and immunobooster. Polyunsaturated fatty acid have shown to exert, present in fish and fish oil, have shown to exert anti-inflammatory and immunomodulatory effect. It's not clear that fish or fish oil consumption may be beneficial against COVID-19 infection. More research is required. I may ask, in my last lecture, one girl asked me, sir, can you name a few fish from where we can get this? Like Bengali, they are accustomed with only rui katla. I'll suggest you that you should take tuna, sardine, mackerel, salmon, pomfret, squid, and crab. Seaweeds, another very important immunity booster agent. In Bengali, we call it tok palum, like spirula, corella. They are edibles, macroalga from the marine products. They provide macronutrients and micronutrients having potential health benefit, elevation of metabolic risk factor like hyperglycemia, diabetes, touch korbe, hypercholesterolemia, and hyperlipidemia, thyroid function, and weight loss. The active constituents are alginate, ficodine, protein, polyphenol, unsaturated fatty acid, and carotenoids, vitamins, and minerals. Seaweeds are potential immunomodulators. More studies are required on the health benefit of seaweeds. So 10 tips how to increase your immunity. Follow this thing nicely. Remember, follow good food guide pyramid and eat balanced food. Eat cereals and fresh seasonal vegetables. Fresh seasonal vegetables and fruits and salad. Every day you should have salad in your diet. Eat animal and plant proteins. Mixed dal is very good source. Bahali khali mug mushur khai. You should take mixed dal. Consume fruits and nuts, dairy products like milk, cheese, paneer, lassi. Consume sea fish, crab, prawn, mussel, seaweeds. Consume ghee, oil, butter, olive oil, and olive oil. Don't be afraid. আমি অনেক কিছু বলে যাচ্ছি, এগুলো কিছু কিছু বাড়িতে মা বাবাকে বলবে যাতে এগুলো তোমরা খেতে পাও। Daily 3 to 4 liters of water, multivitamin and multimineral এটা খুব ইম্পর্টেন্ট। রোজ একটা মাল্টিভিটামিন অন্তত 15 দিন খেয়ে নেবে। এখন কোভিড টাইমে আমাদের একটু ভিটামিনের প্রয়োজন। খাবার থেকে সবসময় রিকোয়ার্ড ভিটামিন আমরা পাই না। রাত্রেবেলা ডিনারের পরে একটা 15 দিনের। লাইক ডেকাডেক্সামিন খুব ভালো, এটা সস্তারও। No, এই পয়েন্টটা মনে রাখো 8 নম্বর, no alcohol, no smoking, no fast food and junk food. Practice 9 নম্বর পয়েন্ট, খুব ইম্পর্টেন্ট, practice daily light exercise, meditation, yoga and spirituality. And important that pseudo scientific and false claim associated with এখন টিভিতে অনেক কিছু উল্টোপাল্টা দিচ্ছে, অ্যাড দিচ্ছে, কিন্তু এই বিজনেসম্যানরা খুব সাবধান, এদের সায়েন্টিফিক ব্যাকগ্রাউন্ড অনেকের নেই ফাংশনাল ফুড নিয়ে, সেগুলো কিন্তু অ্যাভয়েড করতে হবে। So my conclusion is, it is vitally important to maintain a healthy diet, healthy lifestyle to boost your immunity during the pandemic. Very extensive nutrition research and awareness program is necessary. These are the references. Acknowledge once again the President, IMA, and the webinar organizing committee and the group, the Secretary Bijnan Chetona. And please follow me these things. You already know, everybody you know this. Distance, face wash, hand wash. We can beat the corona, no doubt of it. And if you like this lecture, please share with your friends, relatives, and well-wishers. No handshake, namaste, and home stay. So thank you very much and God bless. আজকে খুব কঠিন সময় দিয়ে আমরা ক্রস করছি সারা পৃথিবী। সেই জন্য জাতি ধর্ম নির্বিশেষে আমাদের সকলকে একসঙ্গে কাজ করতে হবে। Thank you very much.
Thank you, Professor Gomes, for your remarkable presentation on boost your immunity with functional foods and fight against COVID-19. Thank you again, sir. খুব সুন্দর স্যার। স্যার এখানে একটা কোশ্চেন এসছে, ডাজ দ্য হাই NLR in COVID-19 act as a contributing factor for the cytokine storm?
Rachna Pramanik.
Yeah.
It's very difficult. আমার পক্ষে এটা অ্যান্সার দেওয়া সম্ভব নয়, কেননা সাইটোক্রোম স্টর্ম নিয়ে জাস্ট কাজ শুরু হয়েছে এবং এগুলো নিয়ে বলতে গেলে আরো গবেষণার প্রয়োজন আছে, ডেটা আরো আসবে, then we'll be able to speak.
Okay. Dear participants, next questions. Dear students, sir, next.
Trika from Belonia, Tripura.
Yeah.
Possible to transmission of COVID-19 virus from an infected mother to her baby through breast milk. না, আমার আগের স্পিকার তো বলেছে অত্রিকা যে মিল্ক দিয়ে কিন্তু হবার কথা নয় যদি না মায়ের কোনো রকম না থাকে। সেই জন্য বলবেন না সব পার্সোনাল কেয়ার, ক্লিনিং, ডিসইনফেক্টেন্ট করে যেন ব্রেস্ট ফিডিং করানো হয়। তুমি আগের ডাক্তারবাবুকে কেন জিজ্ঞেস করলে না এটা অত্রিকা? Miss Bose, sir, I practice exercise every day. Sir, you can tell me about intermittent fasting. Can it increase them? Hey, Miss Bose, thank you very much. মানে আমি ফাস্টিং এর কথাটা বলিনি। বাচ্চা ছেলেরা অনেকে শুনছে তো, ওরা আমার কথা শুনে ফাস্টিং শুরু করে দিলে শরীর ভেঙে পড়বে। নিশ্চয়ই দরকার ফাস্টিং এর, নিশ্চয়ই। মানে আমিও নিজেও করি অনেক সময়, হাফ বেলা অন্তত ফাস্টিং করে দিই। নিশ্চয়ই, it's a very nice question. It should be practiced by the senior citizen at least and the elderly, not the young people. Next. Regular intake of green tea is immune booster or not? Yes, of course. It is already proved. There are a lot of data throughout the world, especially from Japan, then the other countries, Cambodia and those areas. They take regular green tea. When I was in Japan, I used to take regular green tea. So if you don't get green tea in our country, take black tea. That will also serve. Thank you very much, Kollani.
Next.
I think John, don't go for 2 to 3 more questions. Otherwise, time will delay it.
Okay, sir. Thank you very much, sir.
Thank you, Chandran. Very good, very nice. God bless.
Thank you for your nice presentation, sir.
Thank you.
Now we are going to our next resource person, Professor Dr. Somnath Gangobardhay. Good evening, sir.
Good evening. Good evening to everyone.
Professor Dr. Somnath Gangobardhay began his career as an ergonomist and work physiologist in a renowned steel plant under the Steel Authority of India Limited at Bhilai, India. After working for more than 5 years, he joined the University of Calcutta in 1997 as a lecturer in ergonomics in the Department of Physiology. Presently, he is working as a professor in the same department of the university. He has published more than 200 national and international peer-reviewed with high impact factor journals and books. He also been awarded the Ramendra Sundar Sinha Memorial Oration by the Physiological Society of India and the Professor S. Subramaniam Memorial Oration by the Indian Association of Biomedical Scientists or IBMS. Till now, he is extending his expertise in the field of ergonomics for the benefit of more than 25 national and international industries in different sectors and domains. Now I request to Professor Gangobardhay to deliver his valuable speech on the development of MSD during working from home in COVID-19 lockdown. Sir, please.
I think my screen is visible. Hello?
Yeah, sir.
Yes, my
Hello.
screen is visible. Okay,
Yeah.
nice. 1 minute, please.
Yeah.
Yes, full screen mode. I have to make.
Yeah,
First
it's
of all,
fine.
yes. First of all, I wish to give my, convey my thanks to the organizers and, that, and also especially to Dr. Ray for giving me opportunity to give a speech on the, actually it is the result of the COVID-19 lockdown. Already the two speakers already they told about the COVID-19 and how do you boost your immunity to fight against the COVID-19. But now I'm going to tell you about about the result. How do you work from home, and in which way you can increase your efficiency by the use of the ergonomics, so that your performance will be increased when you have to work, because in these conditions we have to work inside our home. So in which way you can increase your efficiency by the application of ergonomics, by changing the design of your workstation at your home. Recently I got one email from an online shop that is working from home. That is when you just click this explore now, this portion, then there's a large amount of different furnitures will come out. That the design of the furniture is very important thing. So when you see the furniture's design, that furnitures are you have to use at your home to increase your efficiency, when you have to work from your home. So this furniture is a great effect, has great effect on the efficiency of the persons who have to work from home. And again, this furniture means the design of the furnitures have some effect. So ergonomics has a great effect on the designing of the furniture, and so in that way, ergonomics has a great effect on the persons who have to work from home. Now it is a conditions we have to work from home. So we have to stay home, means from staying at home, we have to work. And when you go for the work, then again, you have to increase your performance. So first, I wish to tell you something about the ergonomics. When I first entered into the arena of ergonomics in 1984, 82. That time, my teacher, Professor Rabindranath Sen, who first introduced ergonomics. My lab is, that is the first Indian ergonomics lab. It's the birthplace of Indian ergonomics. He used to say that there are the two words, Somnath, that one is the ergon, that means work, and the nomos means the laws. But that time it was very difficult for me to understand the laws. If we just conjugate these two words, that is the work and the laws, what does it mean? That is the law of work. It is very difficult to understand what does it mean, law of work. That law means natural law of work. When a person has to work in this posture, that means he is not maintaining the natural law, then he will suffer from different types of problems. We commonly say that is the, this is the musculoskeletal disorder, like the back pain, shoulder pain, neck pain, like that. And when this furniture or something will be like this, then the back will become straight, and it will be easy for the person to work with the computer, without developing any problem at the back. So this is the condition when the person is not maintaining the natural posture, and it is the condition when the person is maintaining the natural posture. So maintaining of the natural posture is a very important thing, where you can increase the efficiency of the human being. Three important things are there in the ergonomics. We should consider these three things when you go for the working from home. That time we should consider these three things when you go for the redesigning of our existing workstation at home. Then again, we have to think about these three important things of the human being. One is the strength of the human being, then the limitations of the human being, and the requirement of the need of the human being. So strength means you have to, if you make a furniture, it is very difficult to carry, because at home we have to make some furniture, we have to use some furniture where it should not be fixed in one place. We can carry it, we can we can lift it from one place to another place. And if it is very heavy, then it will be very difficult for the person to lift this furniture. So that is the limitation. This is the strength of the human being, and this is the beyond the strength of the human being. This furniture is designed. So you have to think in such a way that you have to design, you have to use the furniture that should be very lightweight. Number two is the limitation. That the limitation is the body dimensions or body height, and and the other dimensions of the human body, and which is very much related with the working station, with the workstation, with the working conditions. And if you don't consider this, that dimensions, then when you go for the redesigning of your workstations at home, then it will be very difficult for you to use that redesigned workstation, because that time it will be very difficult, because it is not totally fit with your actual body dimensions. So the limitations of the human being, limitations means your limitations, you should find out, you should apply when you go for the redesigning of your workstation at your home. And the requirements is, in case of when we work at home, that means we just converse with the computer, we just use the computers, and we just use the laptops, and also we use the smartphone, and we have to converse with the laptops, with the smartphone, with the desktop, like that. And in that case, there are so many things that there which are very much very much related with this workstation, like the keyboard, like the mouse, like the monitor screen. And where should be the screen? Where you should place the screen, so that you can get maximum comfort? Where you should place the keyboard? Then it will be very easy for you to reach the keyboard, to type for the keying the keyboard, and in that way, in which way you can use this thing. So these are all the requirements of this particular workstation. So now we have to work with the computer. Now we have to work with the desktop. Now we have to work with the laptop. Sometimes, and the more and more, we have to work with the smartphone, because we have to attend the class through online classes. And again, we have to take the classes, online classes, through the use of the laptop, through the use of the smartphone, through the use of the with the laptop, smartphone, and the desktop. And so the design of these things is very important. And otherwise, you will feel discomfort. So what is the discomfort? What discomfort you can feel? But before that discomfort, before the feeling, before you go in discussion about the discomfort, I should give you some statistics, or some data is there. Like 56% of the office employees will work from home in near future. And I should add something with this. That is the teacher populations and the student population. If you add the students and also the teacher population with this 56% of the office employees, that will become some 80% or the 85%. So when it will become 85 or 80%, then we should consider at our home as at our workplace. It is like at the workplace. So we should consider our home as a workplace. So we should think very deeply in which way we can change our home in such a way we can increase the performance of the human being. And the next thing is 63% of the workers, they are more productive when they're working remotely. That is, when they work from home, then this 63% of the workers, it is fine that they are more productive. But the most important thing is that productivity that requires 30 to 45 days to get more, at par with when the person will work from office. That means when the person is work from office and when the person is work from home, there's some difference between them, and that difference will have some definite effect on the productivity of the human being. So that will take some 30 to 45 days to get equal productivity. That means the persons have to cope with these new workstations, because there is no proper sit and stand workstations at home. So we have to make our workstation in such a way that will give you maximum comfort at home, and that will give you maximum, that will increase your productivity or efficiency. So the most important thing is health. And when normally we work from home, that's the very important thing is that the musculoskeletal disorders we used to develop, that is the pain at the different parts of the body, like the carpal tunnel syndrome, tendonitis, muscle strains. These are all the things that is due to the bad furnitures, due to the poor furniture, due to poor working conditions at our home. So we have to change these conditions in such a way, and we have to give more emphasis in which way we can place the laptop, in which way we can place the monitor, in which way we can place the keyboard, in which way we can place the mouse, in which way we can hold the smartphone. So these are all the things are very much related with the development of the musculoskeletal disorder, because these these devices are very much related with your posture. So when you apply ergonomics, then we have to think about the proper postures of the human being who have to use this type of devices, to use these devices when they go for, when they used to work from home. And the keyboard height, that is the posture, the keyboard height, monitor height, chair adjustment, and the very important thing is rest. What type of rest you should take? In between the work, you have to take some rest. But what type of rest you should take, that's the most important thing. I should give you some idea about the work-related musculoskeletal disorder. First, it was established by the Bernardino Ramazzini, the 17th century Italian doctor, and he gave thousands. This was his book, Diseases of Workers, and in this book he described about the thousands of musculoskeletal disorders, and these are all related with the different postures. We used to say it is the awkward posture. These are the awkward posture, bad posture, and the repetitive movements of the body. So these are related with the bad postures, bad movements of the body, and in that way they develop some musculoskeletal disorder, the different parts of the body. So these if you correct the postures of the human being, if you correct the movements of the human being during the work from the home, then of course you can prevent the musculoskeletal disorder. So musculoskeletal disorder is the injuries of the soft body tissues, and the muscle injuries, nerves injuries, tendon injuries, joints, cartilage, spinal disc injuries. Commonly you can find several types of pains at the different parts of the body, and this pain will prevent you to work for a longer duration. That will ultimately develop different types of diseases like tendonitis, tenosynovitis, carpal tunnel syndrome, epicondylitis, etc., etc. Dequidifying diseases, ganglion cyst. These are all the diseases. These are related with the musculoskeletal disorder. But the common musculoskeletal disorder is the back pain, lower back pain, and it is due to the low back pain. When you work from home, it is very difficult for you to think about your body, and then the posture, due to the awkward posture, because you have to give your more concentration on the work, not on your body. So these awkward postures, these back postures, create some problem at your back, at your shoulder, at the different parts of the body, and you will feel the pain. So this poor awkward postures, static muscle loading when you are in a static postures for longer durations, repetitive tasks, these are all the things. They create some problems, and ultimately they will develop the work-related musculoskeletal disorder. So we have to apply ergonomics over here as a control measures to change the posture, to change the desk height, keyboard height, and the angle of the monitor height, and the adjustment of the chair is very important. The adjustment of the chair. So chair should be adjusted properly. So chair means there are so many factors are there which is related with the chair, design of the chair, like the casters. There should be the 5-point base. Then you will get more support. The balance of the chair will be there. If there are 4 casters or the 3 casters, then the minimum amount of balance will be there in the chair. So there should be the 5 casters. And the most important thing is adjustable lumbar low back support. That is the very important thing, because if you do work in awkward postures in a chair for longer duration, then if the backrest is not properly maintained, or if there is a poor backrest, then you will feel pain at the back. And again, there's some cushion that is on the seat pan surface. The cushion is very important thing. If the cushion is very soft, again you will feel problem. The cushion is very hard, again you will feel problem. So the cushion should not be very, very soft and very hard, and the adjustability of the tilt of the pan is very important. So there are so many factors are there which are very much related with the seat, with the design of the seat. Like this is the seat pan. There's some waterfall design. There's some carved over here. so that it will not hurt your back of your leg, which is actually it's known as the popliteal positions of the leg. So that will not hurt the popliteal positions of the, and this is the backrest, and this backrest should be like this in such a way that will give you proper support of your back. And there are the 5 casters over there. So if you use the proper chair, then your posture should not be like this. Your posture will be, you will get a very, very comfortable posture. So there are several types of chairs, and some chairs cost like 50,000, some 1 lakh. It is very difficult to provide. Now you have to go for the purchase of the chair, because I have to work from home. So I have to purchase one chair. Now it's very difficult to purchase chair, but everything is closed. And so you have to change your workstation in which way I will give you that suggestion, in which way you can change your existing workstation, not by buying, not by using, the chairs, not by trying to take the chairs from your office like that. So these are the chairs where you can get maximum support, but the cost is very important. The backrest means that your back should be straight. This is also chair, and when you sit over this chair, then your back will become straight. So this type of chair you can use at home, but now it is in India, it is very difficult to get, and and also maybe it is very, very expensive. So the backrest is required at this position, which is known as the lumbosacral region. And over this lumbosacral region, you need the backrest. So the proper backrest is very much important. And sometimes we find that during working from home, we don't use some chairs, and we use the floor, the sitting on the floor. So in which way you can use the backrest? Yes, the person is using the side of the the bed as a backrest. Now he can use some cushions at his back, not so hard, not so soft, so you will get the maximum support, at the back. And if we use some, what is said in the Bengali, it is jol choki, like the, like the desk, like the short-heighted desk. And over there, if we place this laptop and also the other things like the notebook and other things, then you will get more comfort. And if he should use some, headphone over there, and then this tilting of or twisting of the neck will not be there, so the person will get maximum comfort. So these are the very, very, very little amount of change. It is very easily he can make this change. You can make this change at your home, and you will get maximum comfort during working home. So there are some rules out there, and you should know these rules during working from home. That is the place of the monitor in such a way that will eliminate the glare on the screen. So if the window at the back, sometimes it will create some problem, like it will create some shadow on the on the working surface. And if the window is in the front, then again the light will fall on the eye of the person, and it will be difficult for the person to work in the computer. So the window should be at the side, and it's written over here at a right angle or away from the windows or the task light. That means if it is at the right angle, that means it is at the side. If you place your laptop or the desktop and in such a place where you can get light from your side, that the window is at the side, from the right side or from the left side, then it will become very comfortable for you to work, with this laptop or with the desktop. And this laptop, this monitor should directly in front of you. I'll show you some photographs. Here the monitor is placed in a angular position, so the twisting of the neck will be there, and it will be very difficult for the person to work from in these conditions for a longer period. And in these conditions, in all the conditions, the monitors are placed diagonally, so it will create some problems at the neck because twisting of the neck is there. And here the monitor is placed at in front of the person, so there will be no problem. So this thing, that is, monitor should be placed in front of you, not at your side. And there should be 30-degree inclination. That is, means the screen, top line of the screen, that is slightly 30 degrees below your eye level. And if it is not below your eye level, again, if it is higher than your eye level, then you have to look like this. That is, then you stretch, excessive stretch over your neck. And if it is below your, very, very below your eye level, then again it will be difficult for you because you have to bend, your excessive bending of the neck will be there. And then again you will feel pain at your neck. And the placement of the monitor at least arm length, because if it is very near, then again you will feel some problems at the at your eye. So the bending of the head or neck or trunk should not be there. So if you excessive bending should not be there. That means that the monitor placement of the monitor is very important thing in this case. And when it is not a usual case in case of the when you work from home, but if you use two monitors at the same time, then the two monitors should be placed in the V shape. So the two monitors will be inside your visual field. So you should not excessively move your neck to see the two different monitors in the two different places. So that will create that will decrease the problems at your neck. Now the keyboard should be directly in front of you, and because your shoulder should be relaxed during using the keyboard, and the wrist should be straight. And this is a very important thing, that the wrist should be straight. There should not be any bending of the wrist. If there's a bending, then you may develop the carpal tunnel syndrome. There's excessive pain at your wrist. So that in the same height, you should place the keyboard and the mouse. Those keyboard and the mouse should be placed in the same height. And when it is adjustable, the tray, when you use the keyboard tray, that keyboard tray should be adjustable so that it will be easy for you to use this keyboard. And sometimes you can find this, but it is very difficult to find over here. There's some grooves, and in the grooves there's some keys. And when you use these keys, normally your wrist will become straight. So there's no probability of development of the musculoskeletal disorder or the carpal tunnel syndrome. But it is very difficult to get over here. So there's the alternative keyboards out there. And I'll show you another thing, which is known as the pistol grip mouse. And there the wrist will become automatically straight. And if you use this, if you get these things, it is very nice. But now it is very difficult. So you have to adjust these things as I suggest, as I give you some suggestions. Most difficult things with the laptop is, in case of the laptop, that the screen is attached to the keyboard. So it is fixed. The keyboard is fixed with the screen. So you can't remove the keyboard from the screen. So it is a total system, and you have to use this total system. And then the poor neck and the head postures and poor wrist and the hand postures will be there. So for the frequent user, I should suggest that they should use some external devices. He is using some external keyboard to, and it is attached with the laptop. And then he is using this keyboard with the, and in this way he is using these things and he is feeling comfortable. But for the occasional user, you should think about the chairs. There is hundreds of chairs, not hundreds. There's a large number of chairs you will find at your home, and you should find out the best chairs for you, and and which way you can use these chairs. Like it is slightly reclined positions, upright or slightly reclined, comfortable, upright or slightly reclined position, so that you can get maximum comfort by using this chair. And this is the angle of the laptop screen that should be a little bit back, so that there's some 30-degree angle will be formed on the top of the monitor of the laptop, and this laptop should be placed, this way. That means there's some inclined position should be there. Some adjustment already you can find over here, but it is very costly. So you can use your pad book. You have pad books, and you just place your monitors. You just place your laptop over there. So the upper portion, that is the keyboard portion, will become inclined. So your wrist will become straight. So it is a very unique thing, very interesting thing. In that way, if you use, then it will become give you maximum comfort. And the most important thing is you should not work for a longer duration. You should stand. You should stretch your hand. You should move, and then you will get comfort. So this should be regular things. And in case of the smartphone, the same things you can find. That is the postures of the neck will become very the awkward, very bent, and then there's some development of the neck pain, which is the musculoskeletal disorder. So the normal rules is stand tall and straight, and you should use the the smartphone in that way, not in that way, so that there will be no excessive bending of your neck. And again, sometimes there's some tilting of the neck in one side, that is also very bad postures. So you should avoid these things. Like when you bend your neck, then you actually you were carrying the load of your head. Like when it is 60-degree bending of the neck, then you are approximately 27 kg of the weight of the head you are carrying over there. So that will create excessive problems at your neck and also in the different parts of your body. When you're holding the smartphone, then there are several types of diseases because you have to use the smartphone with your thumb, and there's some decurement syndromes maybe you will develop, and also the trigger finger by holding the smartphone in that way for longer durations, and also the carpal tunnel syndrome because the bending of the wrist over there, and like the tennis elbow or the medial epicondylitis. These are the different problems at the at the elbow, excessive pain at the elbow you may feel. So treating the text thumb is a very important thing. That is the take break. Already I mentioned that you have to take some rest during your work. In between your work, you should take some. You should not go through the smartphone continuously for a longer period. And you may use the voice to text the features, and then the excessive movement of your thumb, excessive movement of your finger will not be there. And you should use the stylus in place of the thumb to use this thing. And the most important, most easy thing is switch or change your hand occasionally. Sometimes you should hold the smartphone with your left hand, sometimes with the right hand, and then you will feel maximum comfort by holding these things for longer durations also. Sometimes we give some suggestions about the sitting, standing workstation, and now it is very difficult to get this type of workstation at your home because you have to work from home for a longer duration. Now we have to work from home. We do not know how long we have to work from home. So you can use your kitchen counter, your kitchen platform to place the your laptop and your desktop, so that you have to stand erect and you have to use your laptop and desktop. So that means in that way, sometimes you use it in the in the sitting posture, sometimes in the standing posture. So changing of the posture is very good for health. If you doing the work in a constant posture, that will create some excessive problem. So there's a rules, 20-20-20 rules. That is every 20 minutes you have to take 20 seconds rest and look 20 feet away. That not only that will give some physical comfort to you, but also some mental comfort. And the daily exercises, as already mentioned by Professor Gomes, that is the daily exercise is very important thing. Yoga is very important thing. Some stretching exercise you should do, and then you will get maximum comfort. Your productivity will be increased because we have to work. We have to work from home. We should not sleep because if this is the condition. Then we have to work from home, and when you have to work from home, then we should take the condition in such a way, take the situation in such a way, take the workstation in such a way. Then we'll get maximum comfort by working from home. So thank you for your attention. And now I'm just and now again I'm giving thanks to the organizers to give me opportunity to to say a few words in front of you. Thank you. Thank you.
Thank you, Professor Gangopadhyay, for your outstanding presentation on development of MSD during working from home in COVID-19 lockdown. Thank you again, sir. Now it is open for our interactive session. Questions, please, dear participants. Any questions? Yes, sir.
Yes, one who have lower back pain, what type of precautions he or she should take working from home? If you already develop lower back pain, then it will be very difficult to give you suggestions. But the exercise is a very important thing. Some light exercises, some yoga that will, some back stretch, or the taking rest in between the work is very important things. So he or she should not work for longer durations throughout the 10 hours or 8 hours or 6 hours in longer duration. You should take every rest after 20 minutes only for the 20 seconds, and that will give some health. That will give some maybe it is very difficult to remove the problems, but it will give some help to in that way he can do some work and can put the productivity, because if you already develop the back pain, then it will be very difficult. Now, my presentation is in such a way the person should not, develop the back pain by working from home. But if you already, but there are some different reasons of the back pain development, not only the, musculoskeletal disorder. First, you have to identify what's the reason behind it. If it is only for the, it is related with work, then you go for the exercise and other things. Although you have to take some medicine. Thank you, Kalani, for your, question. Thank you. Thank you.
Next questions.
Sir, can we eat ice cream? Yes, you can eat ice cream. In the 20 seconds, that is the 20 minutes race. That is after 20 minutes, you get 20 seconds. And in that 20 seconds, you can take ice cream. But you have to not look at your ice cream, but you have to look, far away, like 20 feet away, so that you get your comfort at your eye, in your eye, at your eye, and also you get comfort, mental comfort and physical comfort. Thank you. Sir, should there be standard formulated in lines of the ISO post COVID-19 for every organization, office, education institution, etc., to be marked as the providing safe and COVID-free environment? Yes, there's some standard formulated in lines in ISO post. ISO post means that is the International Standard Organization. I think so. You mentioned that thing. Yes, but the International Standard Organization, they also already developed this type of standard, because I am with the, the ISO standard. That is I'm with the ISO, also a member of the ISO. So I found that there are so many standards out there, but we have to, in which we adopt this standard in Indian conditions. That's a very important thing, because there are standards should be adopted in our conditions. And when it is COVID-19 situations, then we have to work from home. Then we have to change the conditions at our home according to our own comfort. That's the most important thing. So you have to think your comfort, because all the human beings are not same. So that is the very important thing. That is the body dimension is not same. So you have to think your comfort, and you have to think your workstation. You have to change your workstation in that way. So don't go for this. Yes, there is a standard also there, and also they develop the standard. They try to, give instructions that everybody should use this standard during the workstation design. But we should, in this condition, we should think our comfort, our individual comfort. And another question, so there is a before Debolina post. Yes, before Debolina post, there was another question. So was there? Okay, sir, can we take any medicine, or what are the? Sorry, this is the question. Yes, can we use cushions on normal chair? Maintain the yes, of course. You can use cushions, but that cushion should not be so hard, not so soft. That's the medium type of cushion. You should place it at your back, at the lumbosacral region. That is the, lower back, means the lumbosacral region. And you should identify your lumbosacral region first. And then you have to put the cushion in that position, and then you will get comfort. It is a very magic type of thing you will find. And again, another thing is also there, that is a footrest. That it is very difficult in our house to get the inclined footrest, but sometimes you can get some footrest also. You please use footrest also, so that you can get the proper support of your foot. Debolina, sir, can we take any medicines, or what are the stretches or neck pain? Oh, that is, medicine is there, but I should not say that you should take medicine to decrease your neck pain, shoulder pain. These are the defined pain. But there are so many stretch exercises out there. Yoga is also there. You should go for the yoga, go for the neck exercise, neck movement of the neck, and also there's some stretching exercise of your back, and you should do it. You can do it during your work also. And that means by sitting on the chair also. So in that way, you can use these things. So maybe...
okay, sir.
My answer will satisfy you. Thank you, Devolina. Right. Yes.
Thank you.
Thank you. Yes, one plan. Sir, how can we see green plants in the closed room for our eyes, as I'm suffering from eye problem? No, green plants is very difficult. If you have window, you can look through the window. But if there is no green plants outside that part, then you have to, if some green cartons, or some posters, green posters or something like that on the wall, and you just look at the wall and you will feel some comfort, the similar comfort you will get. But that should be regular. You should maintain it. Like the 20 seconds, 20 minutes, every 20 minutes, you have to take 20 seconds to look at the 20 feet. That should be the 20 feet distance. And if it is not 20 feet distance, then sometimes it is very small room. Then again, you can, very big posters and something like that, if you paste on the wall, then again, that will give some amount of comfort to your eye. Thank you for this question.
Thank you very much, sir.
Yes.
Thank you
Dr.
very
Ram,
much, sir. Okay.
Thanks for it.
Okay, fine. Now we are going to our next resource person, Professor Dr. Sanjit De. Good evening, sir.
Good evening. So, am I audible?
Professor, yes, sir. You are audible.
Okay. Good evening, everybody.
Professor Sanjit De is a renowned professor of the Department of Physiology, University of Calcutta. He completed his PhD degree on molecular biology and biophysics stream in 1999 from University of Calcutta. He was a postdoctoral fellow of UCLA School of Medicine, Los Angeles, USA from 2000 to 2002. He was a visiting scientist, MD Anderson Cancer Center, Houston, USA in 2008. He joined as assistant professor in 1997, and he has taken the responsibility as a professor since from 2012. He awarded 9 PhD students and currently 5 students took PhD registration under his supervision. He has published 65 scientific articles in peer-reviewed national and international journals with an average impact factor of 4.5.
It's 8
Now I
o'clock.
request to Professor De to deliver his presentation on Let's Take a Walk into No Corona Land. Sir, please.
Okay. Thank you, Chandan, for a very nice introduction of myself. And please select the presentation. I'm already sharing the screen. Is it okay?
Yes, sir.
Is it visible? Okay then. Okay. So first of all, I, as usual, thanks a lot, Chandan, for organizing this nice seminar, and you are working really hard, and all the all the stakeholders. Sorry. So all the stakeholders of the IMA Katwa Branch and also the Bijnan Chetona, so they are really working hard for this seminar, and they are really working very professionally. So that I was listening from the beginning, and essentially I'm representing my university. This is 150-year-old, more than 150-year-old university. And I am presenting 100-year-old department of physiology, and I have chosen because essentially I am not working on the virology or nothing. I'm not immediately working with the virus. However, when Chandan has requested me to talk about these things, so I would like to share my knowledge as a teacher. So I just would like to share some thoughts with my beloved students. I hope that this will work nice for them for the next days of the pandemic. I hope that will end very soon, and the normality will come very soon, and we'll enjoy our life once more. However, so why then I have chosen this topic? Let's take a walk into the no corona land. So this is interesting because I thought that since we are in the lockdown phase, I thought that we should walk, we should stretch, as Professor Gangopadhyay was mentioning. So, in with regard to that, I have chosen that thing that we must stretch out and we must walk into the no corona land. Now the questions are, if I ask you, I know that I cannot get the answer with the interactions, but I thought that I would place some quiz in front of everybody. How many countries have no occurrence of the corona attack? Any idea? So essentially, there is, I did not find that any country yet have not been affected with the coronavirus. I mean, there is one single patient, COVID patient is there in, say, almost 195 countries are there. So around, all of these countries have at least one COVID patient. So that powerful that coronavirus is. Okay, and next question would be, how many countries have no COVID death yet? Now, as my topic goes, we need to walk into no corona land. So we need to identify the which lands are without COVID free. I mean, COVID free, so without coronavirus. But essentially, at least since we did not find any corona-free country, so therefore, at least let's try to find out. I mean, how many countries are there without any COVID death? Surprisingly, so anyways, I won't get any real feedback from my beloved students, at least. So I find that at least 40 countries are there, at least. So they have zero death. Okay, as you see that there are zero death, and you would be very happy to know the happiest country in the world is having zero death, and let them be happier ever again. Okay, and so they don't have any death yet. And also the Vietnam. So actually Bhutan has got some special issues because they are geographically isolated. Okay, and so some of it is also a nearby country like Cambodia, Mongolia. So they also have the zero death. So this is the record from the Worldometer. People now are very much using these things, and the list actually goes on. So at least around 40 countries, they have no death yet. So what is surprising? I mean, how they are happier, why they are living so happily, and why there is so less death. And as Dr. Malik in the first beginning of the speech, and also Professor Gomes, my teacher, he has enlightened us very well. So I would rather, would like to enlighten you with some aspects very quickly. Okay. So, and I mean, what was the secret? Was there any intelligence, prior intelligence, that, or some kind of astrologer was there, that they have provided some kind of information that there might be attack of the coronavirus, so you should be prepared. Okay, or are they really geographically isolated, or the people were immune previously, or got some vaccination earlier, or they got food, something really very strong food, which are giving them the immunity, like as Professor Gomes said. So they already started taking all these healthy foods, or what, or got some preventive outfit. So they were already protected, getting some kind of PPE earlier, or getting all these kind of practices, or government is really fabricating or suppressing the data. So actually, okay, so very quickly, all these answers are essentially, there are essentially no. So they had no prior intelligence, they had no strong astrologer, so they have warned or something like that. So it all came all on a sudden. So just for your information, it all came on a sudden. I mean, there are many conspiracy theories and all, so I'm not going into that at all. So now, in the July 9th, we got the information. It is the Science magazine, they have published this data. They have taken this data from the Outbreak Observatory and the Johns Hopkins data bank. So they mentioned that the zero COVID-19 deaths in the Vietnam on July 9th. Actually, they have, they were claiming, the Vietnam was claiming that we up to July 1st, there were no death. And even up to July 9th, there were no death. And still, it should be like that. They should maintain it. Okay. And so, I mean, what is the secret? Actually, the success story of the Vietnam was, so is my screen visible?
Yes, sir.
Okay.
Yeah.
The story of the Vietnam was possible because of, it is a land which is immediately, neighboring the China. It is immediately south of the China. Okay. China boundary. And yet there is no death, and there are all the growing. So it is also a growing economy. So I mean, what is the magic they made? Actually, it is their epidemiological situation. They handled very, very well their preparedness, their early and aggressive action. It is a communist country, yet they are not. They have not implemented any such suppressive rule, but they have made some serious testing right from the beginning, contact tracing, and they made the quarantine. Even when they heard there are 4 patients, they have flu-like symptoms, they have quarantined those patients, those who traveled from China. And when they heard that there is I think it is the first death occurred on January 8th in the China. So they stopped immediately after that. On 9th of January, perhaps I'm telling the right date, they stopped their outbound flight to China. And even in stepwise manner, they also stopped the their road route to China, because their export is much dependent on China, and they are actually exporting in many other countries. Okay, and so their trade is their vital part of their finance, their economy, and they are where they have used their communication and the mobilization system. They have not used any 5G technology or like that, but yet even the old 4G technologies and all with the existing technologies, they have used it very, very seriously. So that was their key to the success. So actually it was quite possible, quite expected for the New Zealand, that is a developed country. And New Zealand also declared much earlier. It was in the June 11th, they made it that this is the, they are COVID free. And essentially, but there was death. You must remember that there was very less death though, but there was death. Okay. আচ্ছা, আমি তো ইংলিশেই বলে যাচ্ছি, অ্যাডমিনিস্ট্রেটররা আমাকে একটু মানে বলবেন, অবশ্য অনেকেই সবাই প্রায় ইংলিশে বলেছেন, আমার আই হোপ যে no one has complained, so I'm continuing. Okay, all right, okay. So what was their secret? Their secret was the domestic control measures, international control measures. They immediately thought of controlling their flights, at least from those countries those are immediately affected, that is the China. So then they, serially they stopped their flights to, I think next affected was South Korea, then the next one was Saudi Arab, and then the Italy. So serially they have, controlled and eventually stopped all the flights at some point of time. And the case-based interventions. So that is with their intelligence system, they made it. So that actually the Vietnam did not. So they did it, Vietnam actually somewhat like they did it, use their random system. Okay, and almost they have gone to, door to door. To some extent, in kind of drive-through, restrictions were applied, drive-through management system was applied, even for the what the South Koreans did. And surprisingly, you should not take advantage of it. They did not use the masks. Face masks. So that is very surprising. They have not ordered, the government ordered use of the face mask. It was not mandatory. Only for the health personals, only for the doctors, only for the healthcare, caregivers only. So the face mask was essential in the hospital only. Okay, so just quickly, and the lessons for the other countries. This particularly the model of the Vietnam, as also for the New Zealand. So these are real learning points. And many of the New Zealand's approaches may be applicable to other settings. And Prime Minister Ardern credits her country's approach going hard and going early. So that was their key to their success. So we must learn of it. So already the COVID has already invaded in our country. So can we do something? So we cannot go back and backtrack all these. We cannot repent on this. Okay, so why we have not done, why we should, and another point is that we should be wasting my school, the blame game, because this is the time to work and this is the time to contemplate. Okay, so now, so very quickly, I think many of us has already embarked on this, and I would not give much detail on it, but this is the is a positive plus strand RNA virus, actually, which is creating the mRNA and also the proteins. And you'll be surprised to know that this is very, very tiny particle, but not that tiny like other viruses, like other flu viruses, other common cold viruses. Like though we are affected. So like we are affected by all these cold viruses, like when we were around say infant. Okay. Small kids, actually, Dr. Dakto was saying that it was very risky thing for the newborns, but yet we have to bear with. But with proper precaution and all, we can always get rid of all these, COVID diseases into the infants, okay, and the newborns. And there are rhinoviruses. There are around 30 to 50%, and there are coronaviruses. They are already there. At least 7 species affect the humans, and they are about of diameter of 120 nanometers. Okay, already you might be surprised that we may have been affected with coronaviruses earlier, but we did not care about it. We did not so concerned about the coronaviruses like this one. So what is special about this nCoV? That's why it is known as the nCoV. That is the novel coronavirus. Okay, and why it is COVID-19? Because this is the coronavirus disease, and 19 that stands for 2019. Okay, so now this is crucial because of the fact it actually, like other viruses, it also take the root of the aerosols. Okay, so aerosols are, the particles, aerosols were already there. So we did not, even aerosols were much higher when our lockdown was not imposed. It was everywhere. Okay, so pollutions and all, everything was aerosol laden. But this aerosol, actually, this virus actually, take the, help of these aerosols to spread. And that's why with our sneezing, with our coughing, while our talk, we, spread the, virus. And quite obviously, as you understand it, so that is the most easy route is the, nasal route, and also our mouth, or also what else? Our eyes. Okay, so all these things are very, very crucial point of entry for the COVID viruses. Okay, for this coronavirus, for this type of virus, even we actually contracted. How did we get all these, cold and flu viruses? Flu, like in this way only. So say at some point of time we got hold of the train handles or whatever the handrails in the metro or in the stations or whatever. Okay, or even for the senior citizens, they had to hold the handrails. Okay, because those are meant for them only in the ramps and everywhere. So there are always chance of getting all these viruses there, because they stick there. Actually, Dr. Mollik was actually explaining all these things. Okay, so this is the the most serious part of it, that they have some special kind of proteins, also known as the spike proteins. Those are actually have some kind of how can I say, the handshaking thing with our human thing. So they have made somehow they have made make the humans friendly. Okay, some way we have some receptors, those are kind of friendly with their spike proteins. So that's why we got vulnerable, unfortunately. Actually, these viruses were much there. There are lots of pandemics, so there are lots of pandemics earlier. So, but we did not care about it. Even what I heard that half of the population at that point of time have gone during the Black Death, or even say around 5/4 people have died during our Spanish flu time. We don't know. I think the death rate won't be that much. The total death would be contained within a few days or so. We hope so. We are actually preparing so, because we are all looking for the vaccines. But I have some formula for the vaccines, because before anybody develops vaccine, I will give you the formula. Please go say to everyone. Okay. I'm coming back to that. Okay, so now because of the fact, so we need to know all these receptors. So this is the ACE2 receptor, already Dr. Malik has mentioned. And unfortunately, so these spike proteins actually they make the handshakes. That's the point. Okay, so I take this slide from one of my presenter at the UK Physiological Society UK, and this is from the from one of the famous magazine Nature. Okay, and this is this I take this slide credit from the Nature Review of Immunology, and this is the cascade of the injury. Already the cytokine storm and all these things clinically she has mentioned already. And the normal state, this is the thing. So there is no injury or nothing. So this is the capillary lining the alveoli. And when the the COVID-19 attacks, what happens? There are the vascular leakage. and the the lymphocyte and all this, they take a root. So they have a kind of macrophage like projections, and they can find when something is wrong, some chemotactic events are there, or some kind of fibrin clots. So that actually viruses okay, so we need to take care of things, and we need to
I think connection একটু প্রবলেম হচ্ছে।
handshake with that, and when it is entered by the endosome, so that makes the trouble. And the easiest route is obviously the bronchial route, and the lung gets affected, and though the this is the the receptor is not that much abundant. The most, I think, the ACE2 receptor is most abundant in the kidney. Okay, net maybe. So am I audible? Everything is fine?
Yeah. Yes, sir. Yes, sir. Fine, fine.
Great. Okay. And so eventually it can affect your heart, obviously your blood vessels, because they are abundant, they are enriched with the ACE2 receptors. So there are eyes, and that also get the ACE2 receptors, even the brain. So that is the worst part of it. And obviously the liver also. And there are many inflammasome kind of things. So they actually they try to protect ourselves, but unfortunately they come out of it, and to protect our body they make the things much worse. Okay, so this is the famous animal. So I failed to get the answer. So this is the famous animal pangolin, and some way it has made some conspiracy. May not be the conspiracy. The bat actually, some way, I don't know why bat has chosen this pangolin, and this pangolin was eaten by the some people, and then they contracted the virus, and they actually spread the virus like anything. Okay. Now the countermeasures. Okay, so we were happy up till our New Year Eve up to 2020s. Now everybody is blaming 2020. Okay, so I said this is a 2020 is a junk year. So okay, at the end of the year we'll rise. Don't worry, because I will give you the formula of the vaccine. Don't worry, and you will publish before Oxford. Okay, so the countermeasures are we are moving to our spaceship speed. And I mean, only this corona, this actually this that is made us our life miserable, and that we did not go to our night. Also, actually, we went to our nightclubs, and we expensed costly food we got, and we had dance and all everything on the New Year Eve. But anyway, so then we came to know from the 1st January that from the CNN or whatever that some SARS-CoV-2 is coming. Okay. Anyway, so I mean, can we give some break to our life or what? So actually, it was time to break our speed of life. So I think it is a blessing in disguise. I always mention this is a blessing in disguise. Don't take it very seriously that this is a blessing in disguise. We should take and we should I think we should give some ashirwad to corona. Okay, কারণ আমরা এখন তো করোনা ফ্রি ল্যান্ডে আমরা ঢুকতে যাচ্ছি, তো দেখা যাক. So at least I believe that this pandemic has stopped. So that is so now it's time to develop vaccine. Now I think my time is because if I don't give you the vaccine formula, you will kill me. Okay, so I think you prepare to develop the vaccine, so and you have the vaccine in your home. Okay, please prepare it. So do you have vitamin C? Okay, okay, raise your hand. Vitamin D, yes, you have. Vitamin E, yes, you have. Vitamin H, yes, you have. Vitamin I did not write it though. Anyway, vitamin P, yes, all vitamins you have. So the vitamin C is the creativity. You do some creative work in your home. Do it some kind of, so you are good at fine art, right? So you do it and you publish it. So now you have the technology. You just go anywhere and you make some digital art or get some training there. Okay, and D, the diligence for innovative work. Okay, this is the time for all the students. You think. So this is the time for your innovative work. Think physiology, zoology, or anything, botany. You go into the nature. You just observe nature and exercise or yoga or meditation. Okay, actually I need to very quickly go through some interesting slides because the foreigners have done yoga and meditation and they are actually given us the formula now we should follow. Okay, because people have told us to do yoga and meditation and all these things, so we just ignored. We went to buy some pizza, buy some burger, buy some all these Western foods. Now the Westerners are now practicing yoga and meditation. Now we should follow. Okay, because some of the Harvard guy has done it. So now it is time to do some meditation and yoga. Okay, and always be happy. Okay, so happiness, vitamin H. You prepare it in your home. Okay, always remain humorous. Okay, and always remain positive. And I did not mention the vitamin I. So that is the innovation. Okay, please do some creative work, innovative work. So otherwise how the science will go. Okay, so now the gene, lifestyle, and environment. So you see that I would very quickly go through all these things. If we do physical exercise, we'll push the disease wall. Physical exercise towards this, we will get the health. So I hope that this is visible, right? The health, I'm here. I'm just scrolling my mouse here. Okay, and okay, don't fear about the mouse because it won't spread plague. Okay, and if we don't do, we will invite the word clinical disorder. However, if we have the physical inactivity that বাড়িতে বসে আছি আর ওই যে স্যার একটু আগে প্রফেসর সোমনাথ গঙ্গোপাধ্যায় বলে দিয়েছেন ওয়ার্ক ফ্রম হোম কম্পিউটারে বসেও যাই করো আমাকে ফিজিক্যাল ইনঅ্যাক্টিভিটি তাড়াতে হবে 2020 ঠিক আছে এখন সৌরভ গাঙ্গুলি 2020 কিভাবে করবে সেটা সৌরভ গাঙ্গুলি চিন্তা করুক ওকে অ্যান্ড নাও দ্য সাসেপ্টেবিলিটি জিন এক্স যদি আমার ওরকম কিছু থাকে আমার যদি কোমরবিডিটি থাকে কিছু করার নেই ভাই. However, I can ward it off much better way if we do physical inactivity, or we can ward off some kind of physical, the meditation and all these things. So we need to get some kind of vitamins. Okay, and so okay, I'm just we incubated it because of the we made physical inactivity. আমরা ইনকিউবেট করেছি, আমরা সাইকেল চালানো ছেড়ে দিয়েছি, আমরা স্কুটার বাইক এইগুলোকে ইনকিউবেট আমরা নেওয়া শুরু করেছি, রাইট? এবং যতটা সম্ভব আমরা গাড়ি 4 চাকা এগুলো তো আমরা, কারণ ওগুলো ছেলে তো স্ট্যাটাস দেখানো যাবে না, রাইট? তা ওটা ছাড়া কি করে হবে? আমরা একটা চাকরি পাচ্ছি, আমি একটা ভালো টিউশন করছি, আমি যদি একটা বাইক না কিনি অন্তত লাখখানেক টাকা দিয়ে 1.5 লাখ টাকা দিয়ে 2 লাখ টাকা দিয়ে কি করে স্ট্যাটাস দেখাবো? পাড়ার লোক দেখবে কি? ঠিক আছে, ওকে. Now see, physical inactivity actually incubate at least 40 disease. Okay, so I'm not naming them. Okay, you just read it, and this is a famous this guy is famous for this. He is advocating against the physical inactivity. Frank Booth, Washington University. Which one? আচ্ছা, এই যে হেলথ বেনিফিটস অফ দ্য এক্সারসাইজ, ঠিক আছে, এটা ফ্র্যাঙ্ক বুথ এর নামটা মনে করে একটু সার্চ কাজ দিও। এর সঙ্গে একজন ইন্ডিয়ানও কাজ করেছেন একটা সময়। অ্যান্ড ইউ সি দ্যাট এই যে কোল্ড স্প্রিং হারবারে একটা লেখা, ওনার একটা আর্টিকেল বেরিয়েছে, সেটা হচ্ছে যে এই যে কেন আমরা মায়োকাইন্স আমরা এক্সারসাইজ করলে কেন আমাদের বেনিফিট, কেন আমাদের বোনস, কেন আমাদের প্যানক্রিয়াস, কেন আমাদের গাট, কেন আমাদের লিভার, কেন আমাদের ওবেসিটি কেন কমবে, হ্যাঁ, কেন ব্রেনটা ভালো থাকবে, তো সেইগুলোর ব্যাপারে উনি সুন্দর করে উনি প্রেজেন্টেশন দিয়েছেন। সো দিস ইজ কাইন্ড অফ ভেরি আই এম ভেরি মাচ আর্ডেন্ট রিডার অফ হিজ আর্টিকেলস। অ্যান্ড এই যে বললাম ওই যে বিদেশিরা কাজ করেছে, এবারে তাহলে আমরা এবারে কাজ করা শুরু করবো, মানে আমরা এবার ফলো করবো যে আমাদের যে আমরা মেডিটেশন করলে কেন আমাদের হোয়াইট ম্যাটার চেঞ্জেস ইনডিউসড বাই মেডিটেশন, দ্যাট ইজ মাইন্ডফুল মেডিটেশন। এটা একদম পাবলিশ ডেটা, কিন্তু ক্লিনিক্যাল ট্রায়াল, ঠিক আছে, এটা আমার কাজ নয়, আমি প্র্যাকটিক্যালি আমার কোনো ডেটাই নেই এখানে, আমি প্র্যাকটিক্যালি সব ধার করার ডেটা সবকটা আমি স্লাইড শেয়ার করেছি, আমি বলে দিয়েছি, অ্যাকনলেজ করেছি ওই জন্য। অ্যান্ড দিস ইজ অলসো ভেরি নাইস ওয়ার্ক from the public health approach. It is from the Bhushan Pardhaman's work, from the from the Institute of the Pune. It is also attached with the Pune Savitribai Phule University. And meditation and the endocrine health and well-being, actually, I was emphasizing that it is the hormone. Okay, নার্ভাস আমরা মেডিটেশন করছি, ঠিক আছে, নার্ভাস সিস্টেমকে নিশ্চয়ই আমরা কন্ট্রোল করছি, বাট দ্য থিং ইজ দ্যাট ইজ মাচ কে বলতো রবাস্ট ওয়েতে আমাদেরকে কন্ট্রোল করে। আমাদের ওই যে এত ভিটামিন ফর্মুলা বললাম, এই বললাম সেই বললাম, সেটা হচ্ছে যে অ্যাকচুয়ালি আমাদের হরমোন। কারণ হরমোন হচ্ছে আমাদের হারমোনাইজ করছে সমস্ত কিছু, গোটা বডিকে। সুতরাং আমাদের এই যে যোগা মেডিটেশন, এইটার এফেক্টটা অনেক লং টার্ম। সুতরাং আমরা যতক্ষণ করছি, যতটা করব, তার এফেক্টটা ততটাই সুদিং এবং ততটাই হারমোনাইজ হবে আমি যতটা মিনিংফুলি আমার মাইন্ডফুল মেডিটেশন অ্যালং উইথ যোগা করি। যোগা হচ্ছে অ্যাকচুয়ালি মাইন্ড এবং বডির যোগ, অ্যাডিশন, সেই জন্যই ওটা যোগা। ওকে, আর কিছুটা হলেও নেচারের সঙ্গে। ওকে, আচ্ছা, তো নেক্সট হচ্ছে এবারে আমি কনক্লুড করি। আচ্ছা, এইখানে এবারে ওই হতাশা সব কাটাও। তো এই ছবিটা তোমরা কেউ জানো কি? কেউ বলতে পারবে? আচ্ছা, তোমরা তো উত্তর দিতে পারছো না এখন, যাই আমি বলে দিচ্ছি। এটা হচ্ছে যে আমাদের যে ওই আমাদের নাও দিস ইয়ার অ্যাকচুয়ালি পারহ্যাপস 75th ইয়ার অফ দ্য হিরোশিমার যে আমাদের ওই মানে সুন্দর আমাদের একটা বোমা দুটো ফেলেছিল, সেই দুটো বোমা ফেলার এইটা হচ্ছে তার একটা নিদর্শন, ভদ্রতার নিদর্শন হিউম্যান সিভিলাইজেশনের। So only this building, this is the prefectural industrial promotional hall, the only building near the Hydro Center that partially survived part of the Hiroshima's Peace Memorial Park today. So I am sharing this slide from this particular guy. Okay, and it is published in our science magazine. So and they are actually going for this 75th year. See the nature of the damage within seconds. So all vanished. Okay, so যদি জাপান যদি পারে তাহলে আমরা কেন পারবো না? আমাদের তো কিছুই হয়নি, আমাদের কটা মানে যে কটা মিলিয়ন অফ মানুষ মারা গেছেন, দিস ইজ নাথিং। আমরা এটা আমাদের হচ্ছে একটা হিউজ লেসেন্স। ওকে, আমরা সেই জন্যই বলেছিলাম উই নিড টু ওয়ার্ক ইনটু দ্য করোনা ফ্রি ল্যান্ড। আসলে মনের ভেতরে মনের করোনা, মনের ভাইরাসটাকে আগে সরিয়ে ফেলি, তাহলে আমরা উই ক্যান ফাইট উইথ দ্য করোনা ভাইরাস। ওকে, করোনা ফাইট উইথ দ্য কোভিড ভাইরাস। আমরা নিজেরা যদি পজিটিভ থাকি না, তুমি দেখো, নিজেরা যদি আমরা মেনটেন করি, নিজেরা যদি আমাদের এই সোশ্যাল কালচার, সোশ্যাল ডিস্টেন্স এগুলো যদি মেনটেন করি, তাহলে আমরা উই ডেফিনেটলি উইল বি এবল টু abet the COVID disease. Okay, there is no straight cut formula. এবং যদি নিউজিল্যান্ড পেরে থাকে, যদি ভিয়েতনামের মতো ওরকম একখানা রাইজিং ডেভেলপিং কান্ট্রি যদি পেরে থাকে, জাপান যদি পেরে থাকে, জাপানে তো সেই সময় রিসোর্স কিছুই ছিল না প্র্যাকটিক্যালি, কিন্তু তারা যদি পেরে থাকে, তারা আজকে কোথায়? তাদেরকে ধরাছোঁয়ার বাইরে। সুতরাং আমরা না পারার কোনো কারণ নেই। সো স্টে পজিটিভ, এবং জাস্ট এই সময়টা হচ্ছে ইনকিউবেশন টাইম। তোমরা যে যার ভালো মন্দ কাজ, সেটা ভালো মন্দ কাজ একদম নয়, ভালো কাজটাকে ইনকিউবেট করো, ভালো কাজগুলো করতে থাকো, ঠিক আছে? আরো ভাবো যে কিভাবে করতে পারবে। এখন তোমার হাতে মোবাইল আছে, ইন্টারনেট আছে, দেখো যে কোথায় ইন্টারনেটে ভালো ট্রেনিং পাওয়া যায়, আমি ডিজিটাল আর্ট ভালো পারি কি না পারি, সেগুলোকে ট্রাই টু গ্র্যাব ইট। ওকে, অল দিস। ভালো রাইটিং লেখো, ভালো কোথাও লেখা শুরু করো, যারা ভালো লিখতে জানো। কবিতা লেখো, আমাদের সোমনাথ বাবু খুব সুন্দর কবিতা লেখেন, আমার আগে স্পিকার, ঠিক আছে? আচ্ছা, উনি পাবলিশ করছেন কিনা জানি না, তো হিজ খুব সুন্দর কবিতা লেখেন। সুতরাং অল দিস ক্রিয়েটিভিটি ইউ শুড ইনকিউবেট। ওকে, অ্যান্ড আমাদের অনেক টিচার আমাদের যারা রয়েছেন, এবং সব টিচারকে এবং সবাইকে আমি ধন্যবাদ জানাচ্ছি। নাও ইট ইজ টাইম ফর অ্যাকনোলেজমেন্ট। অ্যাকনোলেজ করি তোমাদেরকে, তোমরা পেশেন্টলি শুনেছো, এবং অবশ্যই আমি তো অ্যাকনোলেজ আগেই করেছি যারা অর্গানাইজারদের, আমার মাস্টারমশাইদের অবশ্যই আমি করছি, মাই ইউনিভার্সিটি অ্যাডমিনিস্ট্রেটার্স অ্যান্ড অল মাই অ্যাডমিনিস্ট্রেটিভ সাপোর্ট, and to the IMA Katwa president and all the stakeholders, Secretary Bijnan Chetona and all of the organizing members, and obviously to my family for their strong support. Thank you very much.
Thank you, Professor De, for your valuable presentation on Let's Take a Walk into No Corona Land. Thank you very much again, sir. Now it is the open for question answer session. কারো কোনো কোশ্চেন থাকলে সেটা বলুন। Dear participants,
actually, Chananda, I think Dr. De has left the broadcast, so let's move to Dr. Shorkar. Chananda, can you hear me?
okay. হ্যাঁ, প্রফেসর দে নেই?
না, উনি বেরিয়ে গেছেন। শেষ হওয়ার সাথে সাথে উনি যে কোনো কারণে হোক টেকনিক্যাল ইস্যুর জন্য উনি কেটে গেছেন। তো আমরা নেক্সট ডক্টর সরকারের কাছে চলে যাই। ওকে
ওকে ওকে ওকে Now we are going to our next resource person, Dr. Shekhar Sarkar. Good evening, sir. Dr. Shekhar Sarkar graduated from Calcutta Medical College in 1976 and joined West Bengal Health Services in 1980. After PG from Calcutta University in 1979, he had an affinity for community ophthalmology and did thousands of cataract surgery in rural camps of Katwa and Kadi up to 1992. At Katwa, he restricted Red Cross at a 3-floor building dedicated to the community. Now I request to Dr. Sarkar to deliver your presentation on beginning of COVID-19. Sir, please be proceed, sir.
Good evening, Chandan. Thank you for your kind words. প্রথমে বলি যে আমার আগে বক্তারা যা বলে গেছেন ভার্চুয়ালি আমার আর কিছু তেমন বলার নেই। আমি শুধু জানুয়ারি মাসের কোভিড কিভাবে ভয়ঙ্কর হয়ে এই যে পর্যায়ে পৌঁছেছে তার একটু ছোট্ট গল্প করে আমি এটা বলতে করছি। ছোট্ট গল্প হিসেবে বলছি যে চীনের হুবেই প্রভিন্সে ওয়ান সেন্ট্রাল হসপিটালে ডক্টর লি ওয়ানলিং বলে একজন চোখের ডাক্তারবাবু ছিলেন। তিনি ডিসেম্বরের মাঝামাঝি গত বছর ডিসেম্বরের মাঝামাঝি লক্ষ্য করলেন যে নিউমোনিয়া জাতীয় কিছু পেশেন্ট, নিউমোনিয়া এফেক্টেড, যেটাকে আমাদের ভাষা সার্স বলি, সিভিয়ার অ্যাকুট রেসপিরেটরি সিনড্রোম, সেই পেশেন্ট কিছু এখানে দেখা যাচ্ছে যেগুলোকে টিপিক্যালি সেই কোটাকে ভাবে ফেলা যায় না। সেটা সে তার সোশ্যাল মিডিয়া উইচ্যাটের মাধ্যমে তার কলিগসদের, বন্ধুদের জানায় যে এটা একটা অন্যরকম কিরম লাগছে, কিন্তু তাকে তার অথরিটি এ নিয়ে কোনো রকম ডিসকাস করতে বারণ করে এবং তাকে বলা হয় যে তুমি তোমার নিজের কাজ করো, এটা তোমার দেখার কাজ নয়। সে আবার নিজের কাজে জয়েন করলো, সেটা ডিসেম্বরের মাঝামাঝি। কিন্তু দেখা গেল যে 31শে ডিসেম্বর একটা মধ্যে বেশ কিছু ক্লাস্টার অফ কেসেস অফ নিউমোনিয়া, যেটা ইজ অ্যাটিপিক্যাল অফ সার্স, সেটা দেখা গেল ওই ওয়ান সেন্ট্রাল হসপিটালে। তখন সেই চায়না থেকে ওরা হুকে জানাতে বাধ্য হয় যে এটা, এবং চায়না অ্যালার্ট করে হুকে যে দেয়ার আর সামথিং নিউ কেসেস যেটা দেখা যাচ্ছে। এবং ওরা একটা সন্দেহ করে যে ওখানে যে হুয়ান মার্কেট আছে, হ্যাঁ, ইউনান মার্কেট বলা হয়, সি ফুড মার্কেট, যেখানে বিভিন্ন টাইপের ফিশ এটসেট্রা প্লাস কিছু প্রাণী, প্রেফারেবলি ব্যাট, বাদুড়, এই ধরনের মাংস ওখানে বিক্রি হয়। তা ওরা এটার সঙ্গে তার রিলেশনস একটা আশঙ্কা করে ফ্রম 1 জানুয়ারি 2020 ওই সি ফুড মার্কেটটাকে ওরা বন্ধ করে দেয়। এবং এইটা কেন হলো তার উৎস সন্ধানে ওখানকার বিজ্ঞানীরা একটা চেষ্টা করতে লাগলেন যে কি হবে। বাই 2nd উইক অফ জানুয়ারি তারা যে জেনোমিক সিকোয়েন্সিং এর থ্রু দিয়ে যে গবেষণা করলেন, তাতে দেখা গেল একটা নতুন টাইপের ভাইরাস, যেটাকে এতক্ষণ যে আমাদের যারা আলোচনা হয়েছে SARS-CoV-2, সেই COVID-19 এর জন্য যে ভাইরাস, সেই ভাইরাসটা আবিষ্কার হলো এবং সেটা তখন জানা গেল। কিন্তু ইতিমধ্যে এটা অনেক দেরি হয়ে গেছে। অলরেডি এই রোগটার ছড়াতে শুরু করেছে, কিন্তু ওখানকার যারা চীনের একটা বিশেষত্ব হচ্ছে যে এই জানুয়ারিতে চাইনিজ রুলার ইয়ারে যে ভেকেশন থাকে, সেই ভেকেশনে বিভিন্ন মানুষেরা বিভিন্ন দেশে ওরা বেড়াতে চলে যায়। ইতিমধ্যে যে ডক্টর লি ওয়ার্লিং, তিনি কিছু অসুস্থ হন এবং 10th জানুয়ারি তাকে ইয়ে করা হলো যে তিনি একটা টিপিক্যাল এই ধরনের ভাইরাস রোগে আক্রান্ত হয়েছেন। উনি একটা অ্যাসিমটোমেটিক পেশেন্ট, অ্যাসিমটোমেটিক ক্যারিয়ার একটা চোখের গ্লকোমা পেশেন্টের চিকিৎসা করছিলেন। তখন যেহেতু এটা সম্বন্ধে অত জানা ছিল না, তিনি হয়তো সেরকম কোনো প্রোটেকশন নেননি। এই প্রোটেকশন না নেওয়ার জন্য তিনি এই রোগটা ইয়ে করলেন, ম্যানিফেস্টেড হলেন 10th জানুয়ারি। এবং দুঃখের সঙ্গে বলছি যে উনি 7th ফেব্রুয়ারি উনি এক্সপায়ার করলেন। এবং আমাদের দেখা গেছে যে প্রথম যেটা ম্যান টু পেশেন্ট টু ডক্টর পেশেন্ট টু অপথলমোলজিস্ট, যে প্রথম মানুষ যিনি এই ওয়ার্ল্ডে এইটা এক্সপায়ার করলেন, এবং তিনি প্রথম এই হুইসেল ব্লোয়ার বলতে বলা যায়, যে এই রোগটার সম্বন্ধে একটা, যে নতুন ভাইরাসের কন্ট্রাক্টিবিলিটি কতটা মারাত্মক সেটা সম্বন্ধে তার একটা মানে আমাদের ধারণা দিলেন। তা এই 11 জানুয়ারি উনি মারা গেছেন 7 ফেব্রুয়ারি, কিন্তু 11 জানুয়ারিতে ফার্স্ট ডেথ রেকর্ড হয় চায়নাতে এই কোভিড ভাইরাসের প্রথম পার্সেন্ট হিসেবে। ইতিমধ্যে যেটা বললাম যে মানে ঘোড়া আস্তাবল থেকে বেরিয়ে গেছে, সে সমস্ত মানুষ বিভিন্ন দেশে বেড়াতে চলে গেছে, যাকে আমরা বলি স্টে কানেক্টেড, সেই হিসেবে কেউ জাপান, কোরিয়া এসবে গেছে, কেউ ইউরোপিয়ান কান্ট্রিতে, ইউএসএ কান্ট্রিতে গেছে। এবং প্রথম চায়নার বাইরে যে হয় যেটা, সেটা হচ্ছে থাইল্যান্ড। থাইল্যান্ডে 13 জানুয়ারি প্রথম ডিটেকশন হয় একটা কোভিড ডিজিজের একটা পেশেন্টের দেখা যায়। এবং দেখা গেছে 21 জানুয়ারির মধ্যে 282 কেসেস, মানে 282টা কেস অলরেডি এই 4টে কান্ট্রিতে, চায়না, জাপান, কোরিয়া এবং থাইল্যান্ড, এদের 4টে কান্ট্রিতে 282টা কেস অলরেডি হয়ে গেছে। এইটার জন্য 23 জানুয়ারি থেকে, আমি ডাটাগুলো দিয়ে যাচ্ছি আপনাদের, 23 জানুয়ারি থেকে হুয়ান প্রভিন্স একদম টোটাল লকডাউন হয়ে যায়, কিন্তু তাতে কিছু হয় না, তাতে ডেথ রেট কিন্তু বাড়তে থাকে, এবং 29 জানুয়ারি পর্যন্ত ডেথ রেট প্রচুর বেড়ে যায়। এবং 30 জানুয়ারিতে তখন হু ডিক্লেয়ার করে এটাকে একটা পাবলিক হেলথ এমার্জেন্সি হিসেবে, পাবলিক হেলথ এমার্জেন্সি অফ ইন্টারন্যাশনাল কনসার্ন, বা এটাকে এপিডেমিক হিসেবে হু ডিক্লেয়ার করে 30 জানুয়ারি। এবং দেখা যায় যে মার্চ 16 মধ্যে প্রায় 1,70,000 কেস এফেক্টেড হয়েছে, এবং 157টা দেশে অলরেডি সেটা ছড়িয়ে গেছে, এবং প্রায় 6,000-6,500 মানুষের মৃত্যু হয়েছে। এবং সেই পরিপ্রেক্ষিতে হু সেটাকে ডিক্লেয়ার করে প্যান্ডেমিক। তাহলে সামান্য 1 মাসের মধ্যে একটা রোগের তার প্রকটতা দিয়ে সামান্য এপিডেমিক থেকে প্যান্ডেমিকে ধারণ করে, এবং প্রায় 157টা দেশে ছড়িয়ে গেছে। যেটা একটু আগে আমাদের পূর্ববর্তী বক্তা বলছিলেন যে কতগুলো দেশে, কোন দেশে নেই, সেটাই যেটা এখন আলোচনার বিষয় হয়ে গেছে। ঠিক সেরকম ভাবে আমাদের ইন্ডিয়াতেও এই যে রোগ ছড়ায়, এবং সেটা হয় 30 জানুয়ারি কেরালার সাউথ কোস্টে। এটা প্রথম একটা ছাত্র এটা কন্ট্রাক্ট করে নিয়ে আসে, সেই ওয়ান প্রদেশ থেকেই ছাত্র হিসেবে আসে, এবং 30 জানুয়ারি তার কেরালায় তার এটা ডিটেকশন হয়। এবং সেরকম ট্রাভেল হিস্ট্রি আছে, 2 এবং 3 ফেব্রুয়ারিতে আরো 2জন ছাত্র আসে, এবং তাদেরও এই রোগের লক্ষণ ধরা পড়ে। এরপরে 2 মার্চ ধরা পড়ে হায়দ্রাবাদ এবং দিল্লিতে 2জন পেশেন্টের, তারা যাদের ট্রাভেল হিস্ট্রি আছে। তখন আমাদের এটা বলা হয় যে ট্রাভেল হিস্ট্রি, তাদের অকুপেশনাল হিস্ট্রি, তাদের কন্ট্যাক্ট হিস্ট্রি, তারা যদি কোনো ক্লাস্টার অফ পেশেন্টস এর মধ্যে থাকে তার হিস্ট্রি, এইগুলো লক্ষ্য করা যায়, দেখে তাদের তীব্রতাটা অনুভব করা যায়। এবং 16 মার্চ ইন্ডিয়াতে 110টা কেস হয় দেখা যায়, এবং সেটা 14টা প্রভিন্সে এটা ছড়িয়ে পড়ে। এইটা হলো আমাদের উদাহরণ। তুমি স্লাইড গুলো দেখাবে উদাহরণ। হ্যাঁ, এরপরে নেক্সট স্লাইডে চলে যাও। নেক্সট স্লাইড উদাহরণ। চন্দন, নেক্সট স্লাইডে যাও।
স্যার, এটা ইন্টারনেট কানেকশনের জন্য নেক্সট স্লাইড আসছে না, একটু ওয়েট করুন।
এই যে এসছে, এটা একটু বড় করে দাও, একটু বড় করে দাও, হোল স্ক্রিনে করে দাও। হি ইজ ডক্টর লি ওয়ারলেং, যিনি 7 ফেব্রুয়ারি এক্সপায়ার করেছেন। এবং এতে শুনতে পাচ্ছ? আচ্ছা, এবারে থার্ড ইয়েতে চলে যাও।
ডক্টর সরকার, আপনি কন্টিনিউ বলে যান, কোনো অসুবিধা নেই।
এই থার্ড ইয়েতে এটা দেখাও, এটা কিভাবে ছড়ালো। নেক্সট স্লাইড।
নেক্সট
নেক্সট স্লাইড চলে যাও। নেক্সট স্লাইড না গেলে আমি বলতে পারছি না। উদয় নেক্সট স্লাইডে দাও। এটা চায়নাতে কোথাও এফেক্টেড হয়েছিল শুধু সেটা কারণ সেটা জানুয়ারি প্রথমে, এবং তারপরে গোটা ওয়ার্ল্ডে ছড়িয়ে যায় কিভাবে সেটা আমার পরের স্লাইডে ছিল। যাই হোক, স্লাইডে কোনো অসুবিধা হচ্ছে, নেটের অসুবিধা হচ্ছে না। যেটা বলতে চাইছি যে মাত্র এক মাসের নেক্সট এটা হল বাই দিস টাইম ওটা ওয়ার্ল্ডে ছড়িয়ে পড়ে। এটা অ্যাজ অফ নাও কাছাকাছি বলতে পারা যায় কত রোগী হয়েছে এবং কতগুলো দেশ কন্টামিনেটেড হয়েছে সেই তার একটা ছোট ছবি আছে। নেক্সট স্লাইডে চলে যাও। এটা বড় করে দাও। এটাই যেটা বলতে করছি যে এই রোগটা এক মাসের মধ্যে যতটা বড় হয়েছে, কি কি সিমটমস কি সাধারণত একটা ছবিতে করা আছে, এটা সবাই আপনারা জানেন যে সিমটমস এবং তার স্প্রেডিং এর ব্যাপারে কি কি হয়। যেমন কাশি, যেমন এবং এটা শোনা যাচ্ছে না
স্যার, প্লিজ বি কন্টিনিউ স্যার। স্যার শুনতে পাচ্ছি আমরা।
আমরা এই ছবি ডেমন হচ্ছে না। এর সিমটমস গুলো কি কি হয় তাদের ছবিতে আমরা দেখিয়েছি, এবং সেটা কিভাবে স্প্রেড হচ্ছে সেটা আপনারা সবাই জানেন। হিউম্যান ডিস্টেন্সিং, স্নিজিং, কাফিং, এবং তার যে প্রিভেন্টিভ কি নেওয়া হয় সেটা হচ্ছে তার মাস্ক পরে থাকা। এগুলো প্রত্যেকটাই আপনারা জানেন, সেগুলো আমি শুধু ছবি দিয়ে একটু আলোচনা করেছি। এগুলো অনেক আলোচিত হয়ে গেছে। নেক্সট স্লাইড দেখো। কিন্তু এই সত্ত্বেও আমাদের সারা সমস্ত প্রিকশনারি মেজার সত্ত্বেও আমাদের শরীরে বিভিন্ন অঙ্গে এটা করে। নেক্সট স্লাইড দাও উদাহরণ। বিভিন্ন অঙ্গে আমাদের হয়, যেটা পার্টিকুলারলি লাং, হার্ট, লিভার, কিডনি, এই বিভিন্ন অর্গানে হয়। কিন্তু আমি যেহেতু চোখে আই স্পেশালিস্ট হিসেবে আমি চোখের ব্যাপারে আমার কিছু আছে, বলার আছে। যে এই চোখে যে কনজাংটাইভা তলায় যে ফ্লুইড থাকে, ল্যাক্রিমেল ফ্লুইড এবং টিয়ার ফ্লুইড, এই টিয়ার ফ্লুইড এবং ল্যাক্রিমেল ফ্লুইডে এই জিনিসটা ভাইরাসটা হারবার করতে পারে। এবং এর জন্য তারা অনেক সময় দেখা গেছে যে কোভিড-19 এর ফার্স্ট প্রেজেন্টিং সিমটমই হচ্ছে কনজাংটিভাইটিস। যেমন কনজাংটিভাইটিসে চোখ লাল হয়, চোখে এটা পার্টিকুলারলি ফলিকুলার টাইপ অফ কনজাংটিভাইটিস হয়, এবং চোখে ইরিটেশন হয়, চোখ জ্বালা করে, চোখে ডিসচার্জ হয়, সেই টাইপের যদিও এটা মাত্র 0.9 to 1% কেসে সারা পৃথিবীতে দেখা গেছে যে এই কনজাংটিভাইটিস হচ্ছে কোভিড-19 সিমটম যাদের মধ্যে আছে। কিন্তু এগুলো ট্রান্সমিশন হয়, তার এরোসল ট্রান্সমিশন। পার্টিকুলারলি আমরা যারা চোখের ডাক্তাররা যখন বিভিন্ন পেশেন্টের আমরা হ্যান্ডেল করি, তখন আমরা যাতে কোনো এরোসল যে ট্রান্সমিশন যাতে না হয় সেইগুলো আমরা ভীষণভাবে একটা খেয়াল রাখি। সুতরাং অনেক ক্ষেত্রে তাই বলছি যে কোভিড-19 প্রেজেন্ট করতে পারে চোখে কনজাংটিভাইটিস দিয়ে। সুতরাং এইটা এবং যাদের ল্যাক্রিমেল ডাক্টের থ্রু দিয়ে সেটা ইনফিরিয়ার মিটাস হয়ে গলায় চলে যায়, এবং সে গলায় জ্বলে ইনফেকশনটা শরীরে প্রবেশ করতে পারে। সুতরাং চোখ একটা অনেক অ্যাসিম্পটোমেটিক পেশেন্ট, ওই জন্য যারা কেরিয়ার হতে পারে তাদের আমরা এই জন্য সাবধান থাকি, আমরা বিশেষ চোখের ডাক্তার হিসেবে দেখি এটা। এইটা মোটামুটি এটা। চোখে আমরা যে এগুলো করি, যেমন আমরা যখন স্ট্রিট ল্যাম্প দেখি, আমরা যখন গনিস্কোপি করি, আমরা যেমন অন্য টেস্ট গুলো যেগুলো করি, যেগুলো পেশেন্টের খুব কাছে আসতে হয়, মুখের কাছে আসতে হয়, সেখানে তাদের চোখের সেইটুকু সাবধানতা নিতে হয়। তাই মোটামুটি এইটাই হলো আমাদের চোখের লাইনে আমরা অ্যালার্ট থাকতে বলি। এইটুকুনি আছে। ঠিক আছে চন্দন, এইটাই আমি বলছি। আমার থ্যাংক ইউ। আমি আমার মোটামুটি বক্তব্যটা রাখলাম, যেটা মোটামুটি আমি যেটা বলতে চেয়েছিলাম যে 1 মাসের মধ্যে কিভাবে কোভিড ছড়িয়ে পড়লো সারা পৃথিবীতে, সেটাই আমি জানালাম। ঠিক আছে, ঠিক আছে চন্দন, থ্যাংক ইউ। বলুন। হয়ে গেছে চন্দন, ইউ ক্যান টেক দ্য মাইক।
I think his connection has been lost. Hello.
Actually, I think
Thank you.
Chandanda, can you hear me?
Thank you, Dr. Sarkar, for your nice presentation. Can you hear me, Dr. Sarkar?
I can hear you.
Okay.
I can hear you.
Thank you, Dr. Sarkar, for your nice presentation on beginning of COVID-19. So it is open for the question answer session. Any questions, please? Okay. Thank you, Dr. Shekhar Sarkar. Now we are going to our next resource person, Dr. Rabindranath Mandal. Good evening, sir.
Good evening.
Dr. Mandal, can you hear me?
Yes.
Good evening. Dr. Mandal is a brilliant student since his early student life. He secures star marks in both MP and HS exam. He did his MBBS from Calcutta National Medical College. He worked in many medical colleges and hospitals in Calcutta. He did his postgraduate degree and diploma from SSKM Hospital. Presently, he is working as consultant in gynecology at Katwa Subdivisional Hospital. Now, I request to Dr. Mandal to deliver your presentation on Don't Take Corona Casually. Sir, please.
Thank you, Chandan. With due respect to my speakers and courtesy to the viewers and audience, what I like to tell that with the advent of knowledge, to media, to net, computer, papers, newspapers, most of the educated people are well aware of the corona. But my concern is only with the common people who don't have adequate knowledge and awareness among themselves about these serious viral infections. I have first-hand experience because myself involved in the treatment of patients since March 2020, and thousands of patients were and are being treated by me now. And also, I'm doing so many operations in the hospitals, nursing homes, private practice. But what I think that this is the management protocol. That management is the highest possible use of the available resources. I am working in a Mofussil hospital and gathering is enough there. But I always think the basic things. We know so many things from the different speakers about coronavirus, its spread and so many. And it is prevalent all over the world and the burning question today. But what I think that the basic questions is there. It is just like all or none phenomena. The people are reckless and careless, and there is so many gatherings, and in spite of so many lockdowns and financial loss, it is just increasing and increasing. But why? Because basically we have to think that it is a viral infection. And we know that the virus does not live outside the body or body fluids. So, if there is corona infection, there must be connection to aerosol through fomites or fecal, although negligible. The question is why the people are so reckless and careless? Because case fatality in India is 2.8% and 4.7% abroad. So fatality rate is less, and the most of the people suffering from corona have mild illness, just fever, malaise, myalgia, and case fatality rate is low, and so they are reckless and they are not understanding the gravity of this disease. So because it is a viral infection, we are just I follow, and I just suggest and always request the viewers to convey this message among the people that its solution is very easy, but we cannot achieve it because they do not understand. It's spread. The viral infection, if we like to prevent it, we ought to avoid the closed space. In AC rooms, in gatherings like in the market, in the grocery shops, in the medicine shops, where there is so many gatherings there is spread is there to the aerosol. We should open our windows in the rooms and there is free air so that this microscopic aerosols does not exist there. But today, the people are very much involved in the AC living rooms and the gathering among the common people. So avoid this closed space, always closed space gathering. And personal protection is a vital role because there is a dictum that your security is yours. You have to secure yourself by providing face mask, face guard. Even I suggest my patients and also to me to always keep a pocket sanitizer in the pocket and just wash the hands frequently. And washing the hand would be a dictum, should be a habit among the people. In our day-to-day practice, we used to practice washing hands for 120 seconds. There is 6 steps is there. One step is 20 seconds. But in this corona infection, only 30 seconds soap washing is enough. As because the coronavirus, the envelope is lipid coated and the spikes are protein. The 75% isopropyl alcohol can dissolve this lipid coating and kill the coronavirus. So we have to use this pocket sanitizer in the pocket and frequently just wash the hands with this sanitizer. At the same time, it is to be kept in mind that any sorts of complacency is to be avoided. Whenever we treat patient, we do not move our face to another patient's face. So I suggest anyone not to move their face to other and just maintain a social distance of 1 meter or 30 feet or 3 feet or 6 feet or 2 meters. Today it is said that at least 12 feet should be maintained. That is not possible, but at least total distancing of 6 feet is to be maintained. There is a Chinese proverb, and John F. Kennedy said that the danger in the Chinese literature is depicted in 2 letters. The one letter, the first letter, depicts the character of the problem, and the second letter, there lies the solution of the problem. If we know the spread of this virus, we can easily tackle this virus. But it is unfortunate in our country, like a developing country, most of the people are illiterate and they do not understand the gravity of this situation. And from these gatherings, I believe that from these gatherings, the corona spread is increasing and increasing. But our message to the people should be, is a concrete message, don't be panicky, because fatality rate is less. And the treatment, there is no treatment, no vaccine, only supportive management is there, nutritious diet, rest, and protection of yourself by face guard, by mask, always wear the mask, and our medical personnel wear the gown, the shoe, and etc., etc. But the common people should wear mask always, and if possible, the face shield. That will prevent the spread of the virus. And we just waiting because the number of coronaviruses are increasing and increasing. In our practice, I am a consultant gynecologist, so we are forced to do emergency cesarean sections, and there we are coming in close contact with the patient. But always I keep in my mind that my security is of mine. So maintain this social distancing and just do our duty just peacefully and securely so that we won't be infected. And last 5 months I'm working in this Mofussil hospital and there is no such incidents. This is a hope and my message to the society that we are waiting and waiting unless a herd immunity is formed so that dangerous virus infection will be prevented and the world will be one day free from coronavirus. Thank you very much. চন্দন শুনতে পাচ্ছ? হ্যালো?
হ্যাঁ স্যার বলুন।
হ্যাঁ
হ্যাঁ স্যার বলুন।
হয়ে গেল।
স্যার ইউ আর
Yes,
অডিবল।
yes, yes.
একটু নেট এরর হচ্ছে মাঝে মাঝে, বাট ইউ আর প্লিজ বি কন্টিনিউ। ইউ আর অডিবল।
না থ্যাংক ইউ, কমপ্লিট হয়ে গেছে।
ওকে স্যার, ওকে। আসলে ওই সময় নেটের এরর ছিল বলে শুনতে পাইনি জায়গাটা। ওকে, থ্যাংক ইউ ডক্টর মন্ডল ফর ইউর ভ্যালুয়েবল স্পিচ অন ডোন্ট টেক করোনা ক্যাজুয়ালি। Thank you very much again. So it is open for the question answer session or interactive session. Dear participants, any questions from you? Dear participants, any questions from you? Dear students, yeah. Oh, a very informative session. Thank you, sir. Okay. Any questions? Any questions, please? Okay, it's okay, it's fine. Thank you, Dr. Mondol. Thank you very much again. Now we are going to our next speaker, Dr. Kaushik Bhaur. Good evening, sir.
Good evening.
Dr. Kaushik Bhaur is a brilliant student since his early student life. He did his MBBS degree from NRS MCH Kolkata in the year of 2008. After that, he has obtained DTCD from Medical College Kolkata in 2011. He did his MD in internal medicine from IPGMER and SSKM Hospital, Kolkata in 2015. He was a teaching faculty, KPC Medical College, Jadavpur in the period of 2015 to 2017. He is acting as a teaching faculty, IPGMER and SSKM Hospital, Kolkata since from 2007 till date. He is a live member of Association of Physicians, India since from 2015. Now I request to Dr. Bhaur to deliver your presentation on COVID-19 myths and facts. Sir, please start your lecture, sir.
Yeah, thank you, Dr. Rai. Please share my slides.
Okay.
Yeah, very good evening, the august resource persons, and my heartfelt gratitude to IMA Katwa Branch and Bijnan Chetona, and none other than Dr. Chandran Rai for giving me the opportunity to deliver lecture on COVID-19 myths and facts. While I was traversing in the No Corona Lands by Dr. Sunjit Day, I received a message. The message in the Facebook Messenger, a video message, which shows in a very elaborative manner that COVID-19 is bacteria, not the virus. But the fact is that it's not the bacteria, it's a virus. COVID-19 is bacteria is a myth. The fact is COVID-19 is a virus, and it's a novel virus because day by day the new strains are emerging. Let's discuss about the common symptoms of COVID-19. Few minor symptoms like fever, throat pain, cough, muscle pain, and chills. These are common symptoms, and these are very minor symptoms. One important symptom is loss of taste sensation and loss of smell sensation. This is a very important symptom of COVID-19, and very severe symptom of COVID-19 is shortness of breath or difficulty in breathing. Somebody says that COVID-19 is just a common flu, but it's not. The symptom may vary from very minor symptom like fever and cough to devastating illness like myocardial infarction, which commonly we say heart attack, cerebrovascular accident, which commonly we say stroke, to disseminated intravascular coagulation. So it's not just common flu. It may lead to life-threatening illness. It may lead to death. The myth is COVID-19 is a universally fatal disease. It's an absolutely false statement because the most people who get infected by COVID-19 recover from it. The fatality rate, the mortality rate is only 2 to 4%, the 3% on an average throughout the world. Another myth is COVID-19 affects only the old people with comorbidities. The COVID-19 not only affect the old peoples with comorbidity, but COVID-19 affects the young people too. The slide depicts that the 29% of the people affected in between the age group of 20 to 44 and 5% in the age group of 0 to 19, that is less than 20. So the fact is that COVID-19 infection may affect all the age groups, but the fatality rate is higher on the elderly age group and the persons with multiple comorbidities. Now let's say something about the transmission of the COVID-19. The transmission may occur through droplet routes, through aerosol routes, and through fomite routes. Through all these routes, transmission of COVID-19 may occur. Now, how to prevent the disease? The first and foremost thing is wash your hands frequently with soap and water, at least for 20 seconds. Whenever you cough or sneeze, do it into your elbow. Dispose the used tissues immediately into a closed bins. Avoid contact with others. Try to introduce yourself not by shaking your hands, but by folded hands with the Indian style of namaskar. Avoid any sort of crowds and public gatherings. Avoid touching your face with unclean hands. Avoid touching your eyes, mouth, and nose with unclean hands. Isolate yourself if you are sick. If you are at risk of complications, isolate yourself at your home. Never go out from your home. Work from home if possible and wear mask. This is the only solution to prevent COVID-19. Wear mask. Another myth is the thermal guns that can detect COVID-19 patients. This is absolutely false statement because the name itself explains the thermal guns only detects the increased body temperature. The fever from any cause can be detected by thermal gun, not the COVID-19 infection. So thermal scanner cannot detect COVID-19 infection. Another myth is going on that mask can save lives. Look at the picture where on the left hand side it shows the COVID-19 carrier, that is COVID positive person, and the right hand side the healthy persons. And the first line, both the persons are not wearing masks. The chance of infectivity is very high. The risk is very high. And the second line, the healthy person wearing the mask and the COVID carrier not wearing the mask, the risk becoming moderate. When the COVID-19 carrier wearing the mask and the healthy person not wearing the mask, then the risk becomes low. And when both the persons wearing the mask without any social distance, then the risk becomes extremely low. And if both the persons wearing the mask and maintain a distance of 6 feet, then the risk is absolutely nil. So masks can save lives. The statement is absolutely true. So wear mask wherever you go outside your home. Now, how to put on your mask, use it and take off it and dispose it. This is a beautiful picture that is taken from WHO site, where it shows in the number 1 that before putting on a mask, wash your hands with alcohol-based hand rub or soap and water, cover your mouth and nose with mask, and make sure there are no gaps between your face and the mask. And always remember, avoid touching the mask by using it. If you do, clean your hands with alcohol-based hand rub or soap and water. Replace the mask with a new one as soon as it is damp, and do not reuse the single-use mask. And to remove the mask, remove it from the behind. Do not touch the front of the mask and discard immediately into a closed bin, and wash your hands with alcohol-based hand rub or soap water. Another myth is wearing mask for longer duration is harmful. This is absolutely a myth. It's a false statement. The fact is, the prolonged use of medical masks, when properly worn, does not cause carbon dioxide retention or decrease oxygen, that is hypoxia. So wearing masks for longer duration, if properly worn, it's not absolutely harmful. Rather, it is helpful to prevent COVID infection. Other myth is that the mask should be open during exercise, but this is not myth. This is true. Whenever you do exercise, do not wear mask. In that case, use social distancing. Maintain a distance wherever you do exercise. Never wear mask while you are exercising. Another myth is that the hot and humid weather, alcohol intake, and bleach can kill the virus. No, it's false. The fact is that COVID-19 can be transmitted in areas with hot and humid climates. That's why India is suffering so much. No spraying of alcohol or chlorine all over your body. That will not kill the virus that have already entered your body. So spraying such substances can be harmful to your clothes, harmful to your mucous membranes like eyes and mouth. Another myth is there: the shoes are important source of spreading virus. No, shoes can spread virus, but the likelihood of COVID-19 being sprayed on shoes and infecting individuals is very low. So as a precautionary measure, particularly in homes where infants and small children crawl or play on the floors, consider leaving your shoes at the entrance of your home. This will help prevent contact with dirt or any waste that could be carried on the soles of shoes. So never afraid of shoes because of the COVID infection. Another true fact that adding paper to your soup or other meals does not prevent or cure COVID-19. And another thing is that 5G mobile networks do not spread COVID-19. Somebody thinks that 5G network can spread COVID-19. Somebody thinks if you add some paper to your food, then you are very much protective of COVID-19. It's absolutely false statement. Another fact is that taking a hot bath does not prevent the new coronavirus disease. And another fact is that do vaccines against pneumonia protect you against the new coronavirus? The answer is no. The vaccine against pneumococcal virus, vaccine against influenza virus, vaccine against pneumococcus, that can only prevent the pneumococcal infection and influenza infection. It never protects against COVID-19 infection. Can regularly rinsing your nose with saline water help to prevent infection with new coronavirus? This is a myth. There is no evidence to reduce the COVID virus infection if you rinse your nose regularly with saline water. Can eating garlic help to prevent infection with new coronavirus? No. There is no evidence that eating garlic can prevent COVID infection. So these are all myths. And last but not the least, are antibiotics effective in preventing and treating the new coronavirus? The antibiotics here, we try to mean the antibacterial agents. The antibacterial agents doesn't work against virus, and that too the coronavirus. So antibiotic is not effective in preventing COVID infection. So this statement is false. So but the take-home messages are the COVID infection is highly infectious but less fatal disease. COVID infection involves both young and elderly people at same rate, though the elderly people are prone to develop complications. COVID infection spreads through fomite, droplets, and aerosol route, all three routes. Neither heat nor cold is protective for COVID infection. Neither any sort of food is also protect against COVID-19 infection. What is protective is wearing mask, maintaining social distance, frequent cleaning of hands. These three is the only solution to prevent spread of COVID infection. Thanks a lot.
Hello. Can you hear me?
Yeah.
Yeah. Okay. Thank you. Thank you, Dr. Vor, for your nice presentation on COVID-19 myths and facts. Thank you again, sir. Now it is open for the interactive session. Any questions from the audience, please? Yeah. Is boiled food good for health?
Yes, the boiled food is good for health, but it is not protective for coronavirus. The straightforward answer.
Next question, please.
It must be N95. It must be N95, not 65. Yes, N95 is better for common people. That is surgical mask. The N95 is giving protection only 95%, not the 100%. 10% protection not given by N95. But N95 mask is as equivalent as 3-layered surgical mask. So you can use N95 is the best one. If you do not have N95, you can use 3-layered surgical mask. That to give you adequate protection, but never use the clothing mask, your kerchief. That will not give you protection much more against virus, because the kerchief only can prevent the droplets. Never the aerosols and fomites cannot be cannot be filtered by the kerchief. So you are not very much protective with the kerchief. You are protective with the N95 or 3-layer surgical mask.
The next question. So, sir, what type of mask we should wear? Sir, আপনি
Yeah,
বলেই দিয়েছেন বলতে গেলে answerটা.
already discussed. N95 and 3-layer surgical mask. These are
Already
the
answerটা দিয়ে দিয়েছেন আপনি.
masks.
Okay,
Yeah.
next question. Next question, please.
Can pet animals
Next
spread
question from the
COVID-19?
audience. Yeah. Can pet animals spread COVID-19?
Pet animal usually do not spread COVID-19 infection. It's not true.
Okay. Next question.
How to take vitamin tablets? Few notions are there already. Professor Gomes discussed elaboratively how to strengthen your immunity. We doctors are recommending, and the protocol came from ICMR, to take vitamin C regularly and zinc regularly to boost up your immunity. But the thing is that no drug is there to just boost your immunity by taking 1 or 2 days. So immune booster is a long-term process. In the long way, you have to take adequate fruits, adequate vitamins. In the long run, that will give you the immune booster, not in a short-term way. So if you want to take any vitamin, you can take vitamin C once daily, and you can take zinc once daily, zinc containing vitamin once daily.
Okay, Dr. Vor. Thank you very much again for your nice speech and nice explanation. Now we are going to our last session, that is the vote of thanks session. I request to Sri Purba Bardhaman to deliver the vote of thanks.
Yeah, can you see, Mr. Roy?
Yeah.
Roy, can you see?
Yes,
can
sir.
You hear me?
Yeah. You are audible,
okay.
Sir. Okay.
Okay. Namaskaram to everybody. Yeah, I am addressing Honorable President Dr. Poreshnath Banerjee, Honorable Vice President Dr. Somnath Mukherjee, Honorable Organizing Secretary Dr. Chandan Rai, Honorable Speakers, Honorable Advisory Board Members, our most valued invited guests, ladies and gentlemen. It is my privilege to have been asked to propose a vote of thanks on this occasion. I must mention our deep sense of appreciation for Dr. Monalisa Mollik for her explanation of COVID-19 in USA. Further, I am grateful to Dr. Subodh Kumar Datta for demonstrating a speech on impact of COVID-19 in gynecological practice. I am grateful to Professor Dr. Anthony Gomes for delivering his speech on boost your immunity with functional foods and fight against COVID-19. I also wish to express my gratitude to Professor Dr. Somnath Ganguly for providing a remarkable speech on development of MSD during working from home in COVID-19 lockdown. I also wish to express my gratitude to Professor Dr. Sujit Day for providing an outstanding speech on Let's Take a Walk into No Corona Land. I am grateful to Dr. Shekhar Sarkar for delivering his speech on beginning of COVID-19. I am grateful to Dr. Shekhar Sarkar. I am grateful to Dr. Rabindranath Mondal for delivering his speech on Don't Take Corona Casually. I also wish to express my gratitude to Dr. Kaushik Bhaur for delivering his outstanding speech on COVID-19, myths and facts. I may like to express my sincere thanks to all of the advisory board members of the said webinar. I also wish to express my gratitude to Dr. Chandan Rai, especially the organizing secretary of this international webinar, for hosting the whole program very smoothly. I may like to express my sincere thanks to all of the participants of the said webinar. I am also very grateful to our technical assistant, Mr. Udayan Majumdar. Thank you all. Keep well. Good night, everybody.
Good night.
Thank you.
Okay, sir. Thank you. Good night, dear participants. Good night, everybody.
Now we can end. The
Yes, sir.
session.
Yes, sir. Yeah. The program.